Chairman, I can confirm that the live stream's on.
Thank you. Good morning. Welcome to this virtual meeting of Cornwall Council's Health and Adult Social Care Overview and Scrutiny Committee. Before considering today's business, I will outline the protocols for the meeting. Today's meeting will be live streamed to the public via Microsoft Teams and is also being recorded. When members speak, they may choose to use their video. If the council live stream fails during the meeting and we cannot share the proceedings, I will adjourn the meeting so that the access can be restored. If the issue cannot be resolved, I will halt the meeting and the remaining business will be concluded at a future date. If a member experiences technical issues, I will adjourn for a short period and try to re-establish their connection. Members wishing to speak or ask questions should indicate by typing X in the chat box. As I call members to speak, I will remind you to switch on your microphone. If for some reason you cannot be heard, the democratic officer will advise you. Votes will be taken using a roll call procedure. The democratic officer will read out the recommendation and the name of the proposer and seconder and will then call each committee member names in turn. You should confirm your name and advise whether you vote in favour or against the recommendation, or whether you wish to abstain from the vote. The democratic officer will then count the votes and advise the result accordingly. Where members declare a non-registrable interest or disclosable pecuniary interest, or an interest by virtue of a trade union membership in the matter, and they must leave the virtual meeting. Their departure will be confirmed and they will be invited to rejoin the meeting at the appropriate time. During the meeting, I intend to have a maximum of 2 short breaks. If the meeting runs beyond 2 p.m, there'll be a short break in order for the live stream to the public to be altered. Before we start today's business, I will ask the Democratic Governance Officer to confirm members and officers in attendance. Over to you, Leanne.
Good morning, members. Good morning, members of the public. I will run down each of the members in turn. If you can confirm that you can hear me and provide your location. I see that Councillor Burr has indicated he wishes to speak, Chairman. Did you want him to come in prior to my starting the member list?
Yes, Councillor Burr, please switch on your microphone.
Yeah, sorry to interrupt so early on. Many thanks, Chair, for your opening remarks. It was just a question about voting, particularly reflecting on the experience yesterday in full council. The procedure where each member gives their vote verbally as instructed by one of the officers is quite a protracted affair. And I understand that we were certainly informed yesterday at full council that we are allowed to use the raising hand option. Could that be considered as a more speedy way of voting, just so that we protect time for discussion rather than protracted voting, please?
Thank you, Councillor Burr, and I thought it worked very well yesterday. Ms.
Do you want me to respond?
Yes.
So, Councillor Burr, there was the original option of using the hands up function. We did find that quite complicated because it doesn't register the vote and people don't take down their hands, and also it updates in a rather tardy manner. So hopefully, and we have been advised from the monitoring officer to use the roll call for voting mechanisms. Hopefully with 15 it will be less laborious than 123, but should we get through the voting and with their being any problems, then I can always contact the statutory scrutiny officer or the monitoring officer. Chairman, I see that Councillor Pollard has indicated to speak.
Councillor Pollard, please switch on.
Yeah, thank you, Armand, and morning, everybody. I was just going to suggest, and I take Leanne's point entirely, and I think for important decisions that we make or recommendations we make, then the roll call is essential. But for things like straightforward things like minutes, where there's been no contentious discussion about, everybody's happy, then I would suggest it could possibly be more sensible to use the hands up, Leanne, just for those kinds of normal functions.
Chairman, if you allow me to respond, I think
Yes.
in future meetings that would be a great idea if we put that to the monitoring officer. Unfortunately, I don't think that we are able to do that today, and also for visibility to the public will be expecting a roll call, and I'm not entirely sure what they can see on the live stream in terms of hands up. So I think for today we're going to have to stick with the advice of the monitoring officer, but maybe in future meetings we can alter that, particularly for things like the minutes.
Very good.
Okay, thank you, Councillor Pollard.
Are you, Chairman, are you happy for me to go through the roll call of attendees?
Yes, carry on, please, Leanne.
Thank you. So if I start with members, if you can confirm you can hear me and your electoral division. Thank you. So Councillor Armand-Toms.
Councillor Armand-Toms, Lou Easton, St Martin's division, and from a very wet and windy Lou.
Thank you. Councillor Colin Martin.
Yeah, I'm Councillor Colin Martin, Councillor for Lostwithiel and the Vice Chair of this committee.
Fantastic, thank you. Councillor Bert Biscoe.
Bert Biscoe, Bosco and Truro.
Thank you. Councillor Nikki Chopak.
Councillor Nikki Chopak, Divisional Member for Poundstock.
Fantastic. Councillor Barbara Ellenbrook.
Barbara Ellenbrook, Councillor for Redruth Central.
Fantastic, thank you. Councillor Jackie Gammon.
Jackie Gammon, Bodmin St Mary's Division.
Councillor Loveday Jenkin.
Loveday Jenkin, Councillor for Crowan and Wendron Division.
Thank you. Councillor James Kirkham.
Jane Kirkham, Councillor for Falmouth Smithick.
Councillor Sheila Lennox-Boyd.
Good morning, Sheila Lennox-Boyd, representing Saltash North.
Thank you. Councillor Sue Nicholas.
Good morning, Councillor Sue Nicholas, representing Marazion Perranufno Division.
Thank you. Councillor David Parsons.
Good morning, Councillor David Parsons from Bude.
Thank you. Councillor John Pollard.
Yes, good morning, John Pollard, Hale North.
Councillor John Thomas has given his apologies and he will be arriving late due to an urgent meeting. He will be joining us as soon as he can. Councillor Andy Ver.
Yes, good morning again, Councillor Andy Ver for Tardreth and Gallant.
Thank you. Councillor Peter Williams.
Good morning, everyone. Councillor Peter Williams representing Mabe, St Cluvius and Perranufno.
Thank you very much. I'll come up to John McClevey from Healthwatch Cornwall. I thought him join the meeting. He's obviously not with us at the moment, so I hope he can join us at some point in the near future. Councillor Rob Rocher, who's the portfolio holder for adult care, has given his apologies for late arrival. Councillor Sally Hawkin.
Good morning.
Brilliant, thank you. Just to say, we do have a number of officers presenting today. I'll just give you a rundown of who's going to be in attendance and for what item. So Helen Charlesworth-May, who's the Strategic Director for Adult Care and the Accountable Officer for NHS Kernow. Natalie Jones, who's the Chief Nursing Officer for NHS Kernow. Tracy Langley, who is our Section 151 Officer. Sarah Acton-Page, who's the Strategic Finance Manager. Rachel Wigglesworth, who's Director of Public Health. Keith Cheeseman, Suzanne Wixie and John Price, who are all Service Directors within Adult Social Care. Derek Hoddenott, who is going to be presenting on adult social care charging, and he's from Adult Care and Support. And then for the workforce update for independent providers, we have Val Smith, who is the Service Development Manager, Claire Hall-Davies, who's the Care Workforce Coordinator, and very welcome to the meeting, we will have Mary Anson, who will be a representative from Cornwall Partners in Care, joining us for that item as well. In addition, we have a number of officers who are attending in case they are needed in the background of the meeting. So back to you, Jen.
Thank you, Leanne. We'll go on to item 1, which is apologies for absence, and I note that you've already given that during your briefing. No other absences, please, Leanne?
No, we've had, other than the late arrivals, no, we've had no apologies given.
Okay. Declarations of interest. Any member wishing to declare an interest in any subject on the agenda? No. Okay. We'll go on to the minutes and the minutes of the meeting held on the 25th of November. I'll go through them page by page. If you have a question, please put the X in the chat box, and we'll go on from there. Councillor. Oh, right. Okay. Page 1, page 2, page 3, page 4, page 5, page 6, page 7, page 8, page 9, page 10, 11, 12, 13, 14, and the small bit on 15. I'll propose, and Councillor Martin, will you second?
Yes, of course. Happy to second.
Okay. Over to you, Leanne, to take the vote. Oh, hang on. Councillor Nichols, you've just indicated. Would you like to come in, please, and switch on your microphone?
Yeah, thank you. Yeah, just a query, and I'm not sure where it falls, but when we had a report on the issue of reduction of hospital beds for West Cornwall, we were told that there were going to be 28 beds available in a nursing cum care home in January. I'm not sure who told us that, but that is actually incorrect, and it's not in the minutes about that because it's incorrect. That's still going through the planning stage. So I'm not sure where that goes. Leanne, perhaps help?
Thank you, Councillor Nicholas. I'll listen back to the live stream to see where that was. The minutes aren't verbatim, so not every point will be picked up, but I will go back and double check the live stream to see where that was said, and
Lovely.
The minutes could be amended accordingly if needed.
Brilliant. Thank you.
Councillor Jenkins, please.
Actually, I was going to raise the same point as Councillor Nicholas. We were definitely told that there were going to be beds in January, and as we know, that's not the case. And that was sort of part of our reassurance about there being enough beds with the absence of Edward Hayne as well. So it's sort of linked through the minutes in various places. You know, it'd be useful to actually get the reality in there somewhere.
Okay, thank you, Councillor Jenkins. Leanne, you'll go through the minutes and check what was said, and can that be added to the minutes?
Absolutely, I can go back through the live stream and see where that point was captured and make that amendment subject to the recommendation being amended on the report.
Councillor Martin, before
on that point, I think we've all had Christmas in between times, so how clear our memories are of the last meeting, I'm not sure. But my recollection is that we got we saw the mention of the 28 beds in the report that went to the CCG a few days after our meeting, and that we were quite surprised that 28 beds were mentioned in there when they hadn't been mentioned in our report in advance. And we then got a briefing though from Helen Charlesworth-May explaining that situation. So to my memory, we didn't talk about it in the meeting, but we were told about it immediately afterwards. So that might explain why it's not showing up in the minutes, but I may be wrong. If others remember it differently, I'm sure Leanne can go back and check the tape.
Okay, thank you. Councillor Jane Kirkham. Jane, please switch on your microphone.
Yeah, just to say my recollection was the same as Colin's, because I went to the CCG meeting a few days later and I was very surprised to hear about the 28 beds in Penzance, because we hadn't discussed them at Scrutiny. So I concur with Colin that I don't think they were brought up then.
Okay, thank you. We will, Leanne will listen to the tape and add whatever's necessary. We'll add that to the recommendation that Leanne checks the records of the meeting and amends the minutes to reflect any conversation that took place about the 28 beds. I'll still propose...
I think Helen has her hand up and might be able to help us out on that.
Ms. Charlesworth-May.
Thank you, Chair. Yes, Councillor Martin and Councillor Kirkham are right. We didn't discuss it at Scrutiny. We will. There is actually a public question about the beds, those beds on the agenda later. And John, if John Price is with us, he certainly will be able to provide a little more detail. They are beds that Adult Social Care was commissioning anyway and is commissioning for specialist dementia care. We will be in a position to use those beds in the short term to support our surge planning for winter and for the pandemic. I'm unable, unfortunately, to answer the planning question, but we are content that those beds will come forward in the normal way.
Okay, thank you, Helen. Councillor Nichols, you're indicating you wish to speak to Leanne. Please switch on your microphone.
Yeah, thank you. Given that I recall it was mentioned about the 28 beds at the HASCOC meeting, because I didn't go to the KCCG meeting, and that was mitigating about the closure of the beds down at Edward Hayne. There is no way that these beds are going to be commissioned soon because they still haven't gone through the planning process. So, you know, whatever else is being said, I've been talking to the planning officers. The planning application is still going through. It hasn't been passed or approved yet, and they definitely were mentioned at this meeting. Thank you.
Okay, thank you. Leanne, you wish to come back in?
Thanks, Chairman. Just to say that, as agreed, we can. I will go back and check through the live stream of the last meeting. It's available on YouTube, and we'll check what was said at that meeting regarding the 28 beds. And what we'll do, as you proposed, Chairman, is amend the recommendation that the minutes of the meeting held on the 25th of November 2020 were correctly recorded, subject to the addition of information relating to the 28 beds in West Cornwall, and therefore that they be signed by the chairman. So I can go back and double check that. Just for clarity, this is for this item is for the minutes accuracy, and therefore it's probably best to not have discussion at this point in the meeting.
Okay, that's what's being proposed. I'll propose Councillor Martin.
Yeah, so I'm happy to second that, as long as we're assured that it's constitutional to approve something with that little asterisk next to it. And does that mean that it will come back to us at the next meeting when we look at the minutes there, that we'll be able to confirm that that's been confirmed one way or the other?
Yeah, yes. So the minutes of this meeting will pick up that amendment.
Yeah,
and
exactly.
The minutes will be changed.
Right, so I'm happy to second that that proposal.
Over to you, Leon.
Fantastic. If we can just move to the vote, I will run through it as quickly as I can. If you can indicate whether you vote in favour, against, or abstention. I think Councillor Ellenbrook was absent for the last meeting, but I will go through. So, Councillor Biscoe.
For.
Councillor Chopak.
For.
Councillor Ellenbrook.
Yeah, abstain, indeed, I was not there.
Thank you. Councillor Gammon.
For.
Jenkin.
For.
Councillor Kirkham.
I'm for.
Councillor Lennox-Boyd.
For.
Councillor Martin,
4,
Councillor Nicholas,
4,
Councillor Parsons,
4,
Councillor Pollard,
4,
Councillor Thomas is late arriving, Councillor Tom,
4,
Councillor Vare,
4,
and Councillor Williams.
4.
Chairman, that's all in favour with one abstention from Councillor Wellingbrook.
Okay, thank you, Leanne. We now come to the next item on the agenda, which is public questions. We have 2 public questions. I will read the public question, and Councillor Martin will respond with the answer. Neither of the people that are asking the questions, they may be in the meeting, but they're not asking the questions by themselves. So I'll ask the first public question from N. Mawson, and the first public question is: in light of the closure of 3 community hospitals and the committee's specific wish to see community beds re-provisioned in West Cornwall, will the committee ask the health system for a clear, proper plan for the future step-down unit care provision throughout Cornwall, which can openly and publicly discussed? Which can be openly and publicly discussed. Councillor Martin.
Thank you, Chair, and thank you to Mr. Mawson for that question. So following receipt of your question, the Chairman contacted NHS Kernow regarding their plans for future provision. In response, NHS Kernow explained that the governing body have only made the decision that Edward Hayne Community Hospital is not fit for health and care provision. This means that the inpatient beds do not reopen, and the existing community clinics occurring at the hospital will be relocated at a suitable venue in St Ives. No decision has been made on St Barnabas Community Hospital, Saltash, or Foy Community Hospital. St Barnabas in Saltash remains open for some clinics. Extensive engagement has occurred with the local communities and will resume again once appropriate to do so, in light of our need to prioritise our resource on local COVID response. Additional step-down care provision is continually being reviewed, and capacity in people's homes and in care homes has increased in recent months as part of our response to the COVID pandemic. There will shortly be an additional bedded capacity for 28 discharged to assess beds in a new care home in Penzance. These additional beds and the impact to individuals and the system will be monitored by existing contractual routes. While there is no nationally recognised community bed modelling software, NHS Kernow are working with system partners to review current and expected capacity for beds in the community. At this time, there is no single view of all the beds available within the system, which needs to include care homes and the capacity for care at home. As previously indicated, we know that there are regularly between 50 and 100 people in hospital beds across the county that, if suitable support were available in their home environment, would and should have been discharged. The work that will be undertaken will seek to describe the capacity needed to deliver the right levels of community-based care, clearly linking its development to then revised need for bedded capacity and for the provision of rehabilitation and reablement. We will be delighted to share future plans for future step-down care provision as they become available, and will continue to involve people who live and work in the local areas in the development of those plans. The provision of step-down care will be continually monitored by the committee, and it's an area we will highlight as a focus post the local election. So just to be clear, most of that was the response from NHS Kernow, and the final statement there from the committee is that the provision of step-down care will be continually monitored by us, and it's an area that we will continue to highlight as a focus beyond the local elections. Thank you.
Thank you, Councillor Martin. Go on to public question number 2, and that's from Jay Barker. Is the committee aware that the 28-bed care home in Penzance promised it for January 2021 to offset the loss of Edward Hayne Hospital will not be proposed built, but a conversion of a existing nursery school, and the extensive remodelling has not yet received planning consent. Councillor Martin.
Thank you, Chair. So thank you again for that question. The committee is not directly aware of the status of the care home being developed in Penzance. It usually wouldn't be involved in planning processes. Some members may be aware through their local roles or as members of a planning committee. So in clarifying the answer to your question, NHS Kerno informed the chairman that the additional 28 care home beds are not a direct replacement for Edward Hayne Community Hospital beds. Beds in the new care home will help meet a commissioning need identified in our market position statement published in 2019. Provision of the 28 beds in Penzance will provide much needed additional bed capacity, initially for discharge to assess functions and then for specialist dementia care. So discharge to assess is a person-centered approach to the safe and timely transfer of medically ready patients from an acute hospital to a community setting for the assessment of their health and or social care needs. As the Commissioner, NHS Kerno are working with the provider to bring on the additional provision as soon as possible to support the current COVID pressures. The building is being modified and as such building work is taking place. Sorry, I think there's an extra word in that sentence. The provider has assured us that all the necessary permissions are in place, and we will ensure that all the necessary checks are complete prior to agreeing the final contractual position. So just to clarify, the previous answer we had to the previous question was saying that part of the need for more beds in hospitals is the lack of community provision. The answer to this question is saying that we're hoping that more community provision will relieve the pressure on hospitals. It is not saying that this is a direct replacement for hospital beds. Thank you.
Chairman, you're on mute.
I'm sorry. Thank you, Leanne. As there's no supplementary questions, we'll move on to item number 5, the verbal update on the COVID-19 vaccination. Sorry. Natalie Jones is going to take this. Welcome, Natalie, and we look forward to this briefing. Thank you.
Lovely, thank you very much. For those who don't know me, my name is Natalie Jones and I'm the Chief Nursing Officer for NHS Kerno. I'd like to take a couple of minutes to set a little bit of context on where we are currently and then leave some time for questioning if that's okay with everybody. So glasses off. I took over the programme at the end of October, beginning of November time, when we were planning really without knowing which vaccine we were going to be using. So when we found out that it was going to be the Pfizer vaccine, which is quite difficult to manage, which I'm sure people know about, we had to adjust the plans that we had, and that continually evolving as people learn new things about the vaccine and we are able to adapt our plans. In addition to that, we then had the Oxford AstraZeneca vaccine, which is different from the Pfizer and allowed us to do other things, which also meant that we could adapt and amend our plans. And of course, we will have the Moderna vaccine probably coming along around about the springtime. And again, that will help us to have more available vaccine, but poses its own challenges to being different from both the AstraZeneca and the Pfizer vaccine. So I guess the context really is this is a fast-moving, ever-changing programme, and it's not static as today. I can tell you where we are today, but that will change again in the coming weeks and months. So I just wanted to fast forward really and not go over all of the history of what we've done in the last couple of months, but to where we are currently. So for Cornwall, we have roughly 134,000 people that will be eligible to have their vaccine in Cornwall and the Isles of Scilly. And we're currently looking at the priority groups, as you all know, and those are the top 4 groups which are identified from the Joint Committee on Vaccination and Immunisation. And these for Cornwall and the Isles of Scilly will be around about 88,000 people. And we are committed to giving people their first vaccine by the middle of February in those 4 top priority areas. Vaccines are allocated to Cornwall nationally on a population basis, and this is what we call a push model, which I can explain if people would like me to. So the first priority is to vaccinate all residents and staff in our care homes for older adults, and we are planning to do that by the 24th of January. And along with that, we have been running the programme for our people over the age of 80 and our health and care frontline staff. Moving on after that, we're going to be vaccinating all of those people who are aged 75 and over, and then moving down to 70 years and over, and those who are extremely clinically vulnerable. So those are the categories that we're concentrating on for the next 2 weeks now. So how we've done this so far is hospital hubs are delivering the vaccines at the Royal Cornwall Hospital, at Plymouth Hospitals and North Devon Hospitals, and our staff and patients have access to all of those facilities. They are primarily at the moment for health and care staff, and some people who are attending the hospital anyway for some things like an outpatient appointment, if they're over 80, will be offered a vaccine while they are at the hospital. And we're currently using the Pfizer vaccine on those premises. In addition to that, over the last few weeks on a rolling programme, we now have 13 local vaccination centres which have come online, and more are coming online all of the time. So that will be a changing number. And if you'd like me to let you know where those are, I can do that. They're also on our website if that would be helpful for you to look at. In addition, we are going into care homes to vaccinate our care homes. And if you were in places such as Bude on our borders, you do have access to go into the Holsworthy local vaccination centre as well. So we do have the vaccination centres dotted around the county at the moment, and I am absolutely aware that they're not as close to everybody as we'd like them to be, and that will evolve over time. So those vaccination centres use a mixture of Pfizer and AstraZeneca vaccines, which come down nationally, and we're not told which vaccine is coming, and that makes planning quite difficult, and therefore sometimes it is done very quickly where patients need to be phoned, and there isn't a lot of time for people to make a decision about that. So we're currently recommending that the second dose is of the same vaccine. So if you had your first vaccine using Pfizer, then you would need to have your second dose with Pfizer unless there was exceptional circumstances. And we're booking our second vaccines in for around about 10 weeks, which is 70 days after your first vaccine, so that there's some flexibility if you're unable to attend, and then you can still get your vaccine within the 12-week period. So following that, we will have large vaccination centres coming along imminently, and there will be some pharmacies also that will be looking to deliver the vaccine in the future. The large vaccination centres will start focusing on those people who are over 80, and then we'll go down the age groups that are in the priority order as in the JCVI. We also have a roving model for those people who are housebound, and that is being developed as we speak with the vaccine, and that can only begin with the AstraZeneca vaccine, but we will be rolling that out. One of the things I probably wanted to say is booking for people who go to one of the local vaccination centres are often done by telephone. We ask a few questions around how people can get there and whether they have transport, etc. We're working with our local colleagues in the LRF who are helping with the transport for people who are unable to get to centres or if they're housebound. And we're working with the Dementia Partnership Board who are giving us advice on best practice to help book appointments for people who may have some cognitive impairment. Where we will go from there is we're modelling how we would deliver the vaccine for the categories after the 4. So moving on in our minds from the first 4 categories to categories 5 to 9. And alongside that, we will need to also be delivering the second vaccine to those people who have had their vaccine in categories 1 to 4. So I think that's what we're currently looking at, and I know that's a bit of a canter through, but happy to take any questions. If I don't have the detail around your questions, I'll take them away and try and find out the best I can. Thank you.
Okay, thank you. Right, we have a list.
Quite a few.
Yeah, quite a few. Councillor Parsons is the first on the list. David, please switch on your microphone, please.
Should be all. Can you hear me?
Yes.
Thank you. Thanks for that, Natalie. We in Bude, in this area, we go into Holsworthy because our primary care cluster is across the border. We had a conversation with them earlier this week. They've only ever been given one batch of the Pfizer vaccine, which is roughly 1,000 doses, I believe, and they have to deal with somewhere between 3,500 and 4,000 people. They have no information whatsoever as to what's coming to them and no idea when it's coming to them, so they're a bit frustrated.
Yes.
I just want to be clear that the Cornwall side of things are keeping an eye on that situation because they get their vaccine through the Devon CCG.
They do.
Yeah. Yes. So I don't, I mean, it's always the problem on this side of this end of the county is that because there's the 2 populations on either side of the border, half the population often gets forgotten. 2 questions really. Who's responsible for contacting the patients? So, if I'm an over 70, who contacts me to say you need to come in for a vaccination?
That will be your GP practice, and you will, now that we've got the national booking system, you may also get a letter from the national booking system. So that's added a layer of complexity to, you may receive 2 invites as such, and the choice is actually yours. It's wherever is the closest for you. So you could get an invite to go to the large vaccination centre through the national route, and you can also, if it's better for you for transport or for whatever reason, you could still choose to go to your local vaccination centre. So it's based on population, and that is pulled from the GP records. So the national system knows where people live, how old they are, based on their GP records. So they are the people who would routinely call you, and if you, as you described, people don't know when the vaccine's coming and it might come tomorrow, and then you might get a phone call rather than a letter, and then it would be the practice that phoned you.
Okay, so that kind of answers my second question, which is about where I can go for a vaccine, whether I've got a choice, but clearly I have. So you've answered that already. Thank you very much. Thank you.
Thank you. In answer to your question before about Devon, I have a meeting daily with the regional team and my colleagues in Devon. So if there's ever anything that you would like me to raise, if there's any difficulties, please let me know.
Okay, thank you very much for that. Cheers now.
Thank you, Councillor Parsons. Councillor Loveday Jenkins, please switch on your microphone, Loveday.
Thank you, Chair. Yeah, I've got a couple of questions. I mean, I think it's fantastic how hard everybody's been working to get everything out, but there are glitches, and a couple of them that are particularly in my area glitches. I don't know why, but some surgeries haven't even started doing over 80s yet. And is that down to the surgery? Is it down to availability, or is it down to staffing issues? And how can that be helped centrally? Because it seems to me that where you've got one surgery that hasn't even started and other surgeries, people are on their second doses in adjacent areas, people are feeling that's not very fair. And some surgeries going on to 70s when there are over 80s who haven't actually been called for an appointment and are being told the appointments aren't going to start till February. So is there any way that that can be assisted with?
Certainly. So at the moment, we're not doing vaccines out of every practice. They are in
no,
PCN
it's not about where they're
areas.
from. It's about the fact that even when you're going to a central hub,
yeah,
you're being told we're not actually starting till February from the central.
I will check that because I don't believe that to actually be correct, but I will go back and check.
It's definitely correct. It's definitely correct. My surgery has told all their patients they're not starting until February.
Okay, that's lovely. If you could, do you feel able to tell me where that is so that I can follow that up for you? You can do that offline. Don't feel you have to do that now. But if you could, I'm very happy to follow that.
I believe it's been taken up with the MP as well, so you may be getting it from other routes as well. Lovely. But okay. Yeah.
Did you have another question? No.
Okay.
It was about whether it was to do with the surgery and staffing or whether it was to do with availability. But I think it's probably the surgery and staffing that is the issue.
I will look into that for you.
Thank you, update. Councillor Nikki Chopak. Nikki, switch on your microphone, please.
Good morning, and thank you, Natalie, for that. It was more of an observation, really, having experienced both Devon and Cornwall with the vaccination programme. I wanted to partly, obviously, echo what Loveday said about, thanking everybody that's managed to get this scheme up and running in some shape or form. And I wanted to sing the praises of the operation at Pensilver, which I experienced at 8:30 on Friday morning with my 88-year-old mother-in-law. But there were two things there, really. One was around volunteers that you've managed to motivate and get on board. I was absolutely fascinated, but also really impressed by their commitment, really, and how well organised it was. That was in comparison to where I went on Sunday in East Devon. I went to the Exmouth Tennis Club with my 88-year-old father, and they were really struggling with, and I know it's Devon rather than Cornwall, but I think this is potentially an issue. The Devon organisation was very haphazard. There wasn't any hand sanitizer, antiseptic wipes. They had no volunteers making sure people were sitting down for the statutory 15 minutes. And I think, all I was going to say was obviously this sort of operation seems to be quite patchy. It just happened to be that I experienced both sides of the border. So I was just sort of wondering, obviously I wanted to say about Pensilver, but obviously, if you like, who do I go to say about my concerns in East Devon was the first question. And then the second question was around the notification that both my mother-in-law and father had. My mother-in-law had a phone call. She is totally deaf, so she didn't understand what was going on. Luckily, they have my contact number, so I was able to make that appointment. But it was literally within 12 hours, I think. Obviously they phoned me on the Thursday morning and the appointment was for Friday. So I was just wondering what the take-up was with the phone calls, where obviously people are being phoned fairly urgently by the sound of it to try and get people in for appointments. And are we missing a sort of a whole tranche of people that may well be deaf and not able to hear their phones? And then obviously subsequently they may get a letter, which again my mother-in-law has now received, and she now thinks she's ready for the second one, and obviously she's only just had the first. So there's a sort of slight communication issue there, which I think we need to be ironing out. So that was my 2 points, really.
Lovely, thank you for that. If you would like to give me any details for my colleagues in Devon, I am very happy to forward those on or give you a link to do that yourself. That's right. No worries about that. I completely agree that the supply of vaccine coming down at the moment is not as regular or routine, even today or time of day that enables us to plan as we would like to with any programme. I would say that if people are not able to pick up the phone, and people won't miss their appointment, so it would be like any vaccine programme like flu or anything, where it would be logged on the computer system in the practice that you've been called and not taken up that offer, so you would be invited again, and hopefully, you know, it wouldn't be at such short notice the next time. So sometimes we are told on a Friday that you will get it on a Monday, and that's difficult over a weekend, and sometimes you get, you know, the night before, but sometimes you do get a bit of notice. So at the moment, and I'm sure going forward when nationally this becomes routine and business as usual, because we're going to be doing this for some months, aren't we, it will get smoother. I'm a very optimistic person, but I do think it will get better over time. We're probably just ironing out those problems of starting up something new.
Yeah, okay, thank you for that. And obviously, yes, if you could pass on my say thanks to those volunteers and the staff at Pensilver, they were absolutely excellent. And whether they'll still be as enthusiastic in about 3 weeks' time, I don't know. But
or 3 months, or
oh yeah, exactly. Yes, yeah,
exactly.
I have hands up from Rachel Wigglesworth, our Director of Public Health. Do you want to come in, Rachel? Thank you.
Thank you, Chair. Just a few points really to really welcome the delivery and the rollout of vaccination in Cornwall. I mean, this is absolutely what we need in terms of protecting lives and the next stage in managing sort of you know, health impacts of the COVID pandemic. So really recognise and welcome the approval of the vaccination. I think we need to recall that the Pfizer vaccination was only approved in early December. So the progress has been made is extraordinary, and the demands are really quite extraordinary as well. So just to reassure Scrutiny that the Health Protection Board, the COVID Health Protection Board, has oversight of the vaccine uptake. So in terms of my role as Director of Public Health, I'll be looking at the data as that's received in terms of my role in surveillance, as I do for all of the other vaccine programmes as well in Cornwall, to ensure that we have the right coverage in the right places for the most vulnerable as we progress through the programme. And also, I think there's a really important message to our public around as the vaccine is rolled out and more people are vaccinated, that we don't forget the public health actions and we continue to do social distancing and the other measures, because at this time we don't know that it will protect from being infected and then transmitting. We just don't know that it stops people becoming unwell and really drastically reduces the need for treatment and hospitalisation. So if we do all of the coverage of the high risk groups, so the 9 groups, then that should reduce by 99% the deaths and hospitalisations. And then just finally, I think just a note on flu. So clearly we have had a low flu season because of probably all of the distancing and lockdown measures and others. But you know, it's still a serious disease, and the flu vaccinations are still available. So encourage people to continue to do that, and also that we have learned some of the lessons through the flu vaccination and the mass programme that was underway and is still underway over the winter, and including drive-through. So I think that's really helped the learning in Cornwall to be ready for this type of approach, and support the NHS, and I know all of our colleagues do, to continue to roll that out at speed. So thank you very much.
Thank you, Ms. Wigglesworth. Right, we'll go on to the list. Councillor Sue Nichols. Sue, please switch on your microphone.
Morning. Yeah, and I'll echo what everyone else has said as well about the rollout and the way that things have been done. However, 2 things really. Firstly, from what Rachel was saying, I'd be quite interested to look at the ratio of patients that have been vaccinated. as opposed to the ones that haven't been vaccinated in our particular divisions. My concern is that people are still, I mean, I know the central services have to be done for the Pfizer vaccines because of the storage temperatures and all the rest of it. But if we're rolling out the AstraZeneca, which can be stored in an ordinary vaccine fridge, then are we going to start seeing more of this being done in local surgeries? I mean, my local surgery did an absolutely brilliant job of doing the flu vaccinations over a weekend and whatever. At the moment, those who live around the Marizine area are having to go to Hale, which has not got very good parking facilities or anything else. So I think I'd like some reassurance that those are going to be on board, and maybe make the point to the department that actually in rural areas we need the ordinary vaccines, that not the Pfizer one, because we don't have the facilities.
Yes, we are at the moment having a mixture of both, and that's availability of vaccine really, so that we can have the more vaccine we take what we're given really. So yes, I am sure that we will get more AstraZeneca as time goes on, and that will be more helpful for people in their own homes, in pharmacies, in practices. So that is the plan, to have things being able to be delivered closer to home, definitely.
Lovely, thanks.
Thank you, Councillor Nichols. Councillor John Pollard. John?
Yes, thank you, Armin, very much. And just can I also endorse the view that, Natalie, you're doing a fantastic job. This is a huge logistical issue and problem, and I think you're doing remarkably well. I wanted just to support Loveday, because Loveday and I share the same surgery, and talk about messaging. Where I live, in my close, there are 3 80-year-olds. Each of those 3 attend different surgeries, and 2 of them have been vaccinated, and 1 has been told we won't even start looking at you until February. Now, it's the message they're getting, because obviously they feel, well, why am I left out? Why don't I get it? Is my life not as valuable as the others? And I think we need really to support them in that, as well as sorting out why. In this area, we have, somebody living in the same street has to wait 3 weeks longer than somebody else. The other issue about messaging for me is, and I admit I am in group 4, is that Boris has been saying, and I'm pleased that you've just said, Natalie, that all 4 top groups will be vaccinated by the middle of February. But over the weekend, NHS locally was putting out that in Cornwall it would be by the end of February. Now, again, it's a mixed message, and people need clear messaging, please. And I'm sure that's not your department, but can you just tell whichever department is doing the communication to make sure that it's very clear and people are getting more message?
Will do. Thank you. I think the messages do change to being quite vague. The middle of February, is, it's not clear, is it? So I'll definitely take that away for our comms teams.
But I think my point is, which one's right?
We have a plan in Cornwall to deliver offering the vaccine by the middle of February.
Excellent. Well, then I don't know why two communications in writing said the end, but I'd leave that with you. Thank you.
Thank you.
Okay, thank you, Councillor Pollard. Councillor Barbara Annenberg. Barbara?
Yes, thank you, Chair. My question really is, and I have to admit, it is a one of self-interest to an extent. When people who are clinically vulnerable are being vaccinated, are their carers also going to be offered vaccination at the same time?
We are looking at, currently, we're looking at those people who volunteer and who care for people to be vaccinated at the same time. That's logistically difficult to manage, as often carers are not registered with their general practitioner as a carer. Sometimes they are and sometimes they're not. So I think what I would say is that would be the plan, but isn't always as easy as we would like it to be. So if people are not getting that, then I think that is something that can be raised and we can try and work through that. So I would say it's a bit clunky at the moment and it might not be as smooth as we would like it to be.
I mean, I do also ask this question as a member of the Carers Partnership Board, because I feel sure that the issue that we have, and it's something that everybody knows, is that there are a huge amount of informal carers, you know, and very often they are looking after vulnerable people, and nobody really realises that's what they're doing.
Absolutely.
So that would be really useful. And the second thing to say, I have to say my surgeries, which is the Red Ruth ones, Clinton and Manor, vaccinated my elderly mother. She had her second vaccination last Sunday, in fact the Sunday before, and it was an incredibly well organised and well run operation. I have nothing but praise for the completely professional way in which it was done, and you know, I'm sorry for those who have not had good experience, but I can honestly say that Manor Surgery and Clinton Road Surgery have done a superb job here.
Thank you. That's lovely. That's really good, and I'll feed that back to people. It's good to have positive stories, isn't it?
Yes, indeed. It's not all doom and gloom.
Okay, thank you, Barbara. Councillor Jane Kirkham. Jane?
Thanks very much. Thank you for that. It's brilliant that it's finally coming out, and it seems to be a lot quicker than some of the other things like PPE and testing have been, so that's good, really good. I've got some questions on more of the numbers, really. I was going to ask firstly about the national booking system and the way the PCNs are doing it, which is obviously separate. The national booking system, you said that was for the large vaccination centres. So are people getting those letters for those 13 centres that we currently have in Cornwall? Because we don't have one of the large vaccination centres, do we? And I wondered if you could just say a bit more about those 13 centres, and the more you said that should be coming, how many more are coming and where they will be. So that was question one. Question two was just to ask if you had any details about the numbers, because if we're going to get I know number one, the over 80s and the care home residents and staff, etc., is rolling out now. Do we have any idea from the PCNs and from these the national booking system how many people have been vaccinated in Cornwall so far, and what the spread of that is across the county as well? So that was the second question. And the third question was just about volunteers, because obviously the PCNs are all doing it differently. Some have their own volunteers, I assume. I wondered if Volunteer Cornwall were being used on a general basis, and whether the PCNs were aware that there's lots of people sat everywhere across Cornwall who could come and help.
Yeah, so I'll try and do those in order. So the 13 centres that we currently have, would you like me to run through where they are?
Please, quickly, if that's all
right.
So
just quickly, so they're in Bodmin, St Austell, Truro, Falmouth, Newquay, Red Ruth, Mount Hawke, Penzance, Pensilver, Helston and Roach. And we have others in the pipeline, which I'm not able to confirm because I actually don't until they are confirmed. But we will be in areas that have the geography and the ability to do that. People are looking at putting up other centres, and I think, if I'm really honest, I think eventually they will be in GP practices and pharmacies locally. So it might not be that these will be forever where the vaccination centres are. Like, you know, at the beginning I was saying we started out by trying to accommodate the vaccine, really is how we did it. But as we could get more of a vaccine that suits us in Cornwall, we will be able to spread that further. One of the things about the Moderna vaccine is it needs to be stored at -20. Now that's not -70, but it's also not fridge. So it's just another complexity. So I think we are at the moment just trying to manage the vaccines in the best way that we can, rather than being able to say that we can put them in every geographical area, which is of course what we want to do and where we will finally get. We're just not at that point at the moment. So the national booking system is for the larger vaccination centres. So I know the terminology is difficult, isn't it? Because you have the hospital hubs and then you have the local vaccination centres, which are those that are just listed. And the larger vaccination centres will hopefully be geographically split between putting one slightly more down to the west and one slightly more up to the north and east. And those are being commissioned by NHS England, and they will come online shortly. So if you get a letter for one of those, that will be from the national booking system. So the GPs that are phoning at the moment are for their local, what we call primary care networks, and they're for the PCN. So that is a bit more complicated, and some people over 80 may get a contact from the hospital hubs if they were going to be attending for an outpatient appointment, or if you were going in for renal dialysis. Do you know what I mean? If you were in one of those 4 cohorts and were attending the hospital. So it's not as easy as to say you will get it from one place. I know that's complicated and it's actually quite difficult to manage. And going on to the numbers, that's why that's been quite difficult to manage as well. So we have a national IT system where all of the numbers from the various places, whether that's in a hospital hub or in a primary care network, go up to a national database. We have been assured that we will get the data back out of that. I don't have that for you today. I can't tell you what that looks like by area because I don't have that information, but I am assured I will get it.
Do you have any idea why we haven't got that information yet? Because that really isn't very good, is there?
I think probably because it was a new system that was developed particularly for this. There are 2 platforms that so the hospital puts onto a different platform than the PCNs. I think it's just, I'm not an IT person. Yeah. I would like to tell you what the IT challenges are because that's really not my thing.
No, that's fine. You just think they could sort out a database quite quickly.
And honestly, they are telling us we will get that data. They can manage to tell us, can't they, on the news every night what it is nationally. Yeah. They will be able to tell us what it is regionally. So I think it's coming. I think it's just that it's not as easy at the moment to get what I would call really reliable, validated data out of the database. And therefore, probably people are a bit cautious about that.
That would help certainly with the queries that Loveday and John are having with the different surgeries. We could really pinpoint where the holes were, couldn't we? It would
absolutely
really...
because what we would like to do locally is be able to match the vaccine to the need. Yeah. Rather than where it's coming down. So at the moment it's being pushed down to a locality and the locality are using that vaccine, and it would be helpful for us to know that we could move. So we can move the vaccine about a little bit. We can't do that with the Pfizer. But between practices, if you have AstraZeneca, you can move the vaccine about a little bit. You have to have a good audit trail of where the vaccine has been delivered so that the vaccine that any individual has got, you've got a clear indication of batches, etc. If there's any adverse reactions to things, that sort of thing. So it's all signed for, it's all logged. So if you have your vaccine, the batch numbers put down. So the database in itself is quite complicated.
Okay.
I think it's just because it's all new.
Thanks very much.
Lovely, thank you.
Okay, thank you. Councillor Colin Martin. Colin.
Thank you, Chair. Thank you, Natalie, for all that information. I've got a whole host of questions. I'll try and go through them in a logical way.
Okay.
And if it's all right, I'll do them as little short questions. You can give me little short answers.
Oh, okay.
So, you said Cornwall has 330,000 people eligible to be vaccinated. Is that the same as the top 9 priority groups, or is that everybody that's going to get it in total?
That's everybody. So children under the age of 18 and those who are, for whatever clinical reason, are not eligible. So that's the total number of people over 18. That's the number that we've been given as being eligible. But of course, there's 2 vaccines, so you would need to double that.
Sure. I'm just wondering, that sounds like about 60% of the population there. So I'm surprised that 40% of Cornwall's population are under 18 years old. It's not something like, you know, only the over 50s are going to get it or anything like that. He says the man in his 40s who's wondering if he's going to get it.
You are definitely going to get the vaccine, and that will be after the top 9 cohorts. So I'll track your numbers, because you could be right, and it could be the top 9 cohorts, but everybody will get. So as I was describing that, I'm now thinking about the 5 to 9s, and after that I'll be thinking about everybody else.
Yeah. Okay. Well, if you can come back to us, you know, at a later date, if you get a different figure, that, you know, yes, 334 sounds to me like maybe the top 9 groups. I would have expected a figure closer to, you know, 450,000 if it was.
I'll check the number for you.
Only the children that were missing out. I'm also a little bit concerned, and maybe this is beyond all of our expertise, if what we're saying is we're going to leave the virus circulating in the under 18s because they don't tend to get seriously ill. That kind of creates a danger of, it's a bit like taking, you know, 80% of your course of antibiotics and leaving the last bit untreated. You tend to get mutations and you know, more serious things. Anyway, that's just a concern. I'm not asking you to answer that one. The target for mid-February, to be clear, I think the government has promised that it will offer vaccines to all those groups by mid-February. And our track record on promises for bold targets last year, where lots of test kits got put in the post and counted on the last day of the month, it is possible that might mean that in some parts of the country, lots of letters just go out on the 14th of February saying you can have your vaccine in a month's time. I hope that's. It sounds like you actually have a plan to deliver by then.
We do have a plan to deliver.
I'm really pleased to say that you say that the vaccines are being allocated nationally by population. We've worked very hard in Cornwall to keep our prevalence down, and I'm glad to hear that doesn't mean we're going to be penalised by getting the vaccines more slowly than other areas. That's very good. On care homes, did you say how many care homes we've actually covered now?
I haven't said that because it changes on a daily basis.
A little while ago.
But
you're happy.
Our deadline is the 24th, which is Sunday. So my ambition is to have everybody, by the 24th.
Okay, so that's care homes. All care homes in Cornwall should be done by Sunday. That's brilliant.
Yes.
What about that's care homes for older people? What about care homes for people with learning disabilities? Are they, because we've seen that they have very poor outcomes as well, but are they not a priority group, are they?
They're not in the same priority group as people who are over 65. So the care homes for people who are older are over 65. That's the category. So we do have some mixed homes where we have people with learning disabilities who are under 65. But the care homes that are on the list for the 24th are for people who have residents who are over 65.
Okay. I'm a little unclear as to how much flexibility you have in adding bits in there. So, for example, do we have any power to say actually we're going to bump adults with learning disabilities in care homes higher up the list, or to say that we think that homeless people should be higher up the list, or are we sort of absolutely rigidly told to do what the national plan says?
We get the vaccine that we get based on population, and if we chose to make that decision where we vaccinated people who in other categories, it doesn't mean we would get more vaccine for those people who are over 80. Because the vaccine we get pushed out at the moment are for the categories in the top 4 priority areas. So I push up the line on my daily calls with NHS England, often talk about people with learning disabilities. One of the plans I have had to put in are for our hard to reach groups and people who are homeless. In Cornwall, that isn't many people over 70, but we do have a plan for those people as well. So there are lots of different elements of it that are running concurrently, but to answer your question, we are prioritising the groups that the JCVI have prioritised, and that's the vaccine we're getting.
Yeah, okay, fair enough. Finally then, just to move on to the different settings where things are being rolled out. I think some people were surprised that after months of waiting for a vaccine to arrive, that they're now being told, well, you know, we can't start delivering vaccines locally in Lou just at the moment because there's some licensing issue with a venue, and so people will have to drive all the way to the middle of the moors to get done in Pensilva. Can you just clarify for me, was there something about an extra quirk in the licensing regulations that couldn't have been anticipated, that meant although there was a good plan in place, it then was forced to change at the last minute? And are these, when we get down to sort of P-level vaccinations, are we basically anticipating they're virtually all going to be the Oxford and not the Pfizer?
No. So we will end up, I think, having multiple vaccines. So as new vaccines come online, we will continue to utilise whatever vaccines available. So Pfizer is continuing to produce, so we will continue to use it. We will continue to use the Oxford AstraZeneca. When we get Moderna, we will pop that in as well, and we will continue to use it. What becomes logistically challenging is if your first dose is Pfizer, because that was the first one that came out, your second dose needs to be that. So we will always have Pfizer in the chain because we will need to use it as a second dose, and to roll it out for people in hospital settings. It's easy enough to use in a hospital setting.
Sure, but just to be clear, you know, if we're, as Cornwall, we're receiving a mixture and we'll continue to receive a mixture, are we saying that we'll send the tricky ones to the bigger sites that can handle it, and then the local sites like GP surgeries only need to be able to have a fridge to handle the Oxford? Or are we saying we're going to sort of give everybody a mixture in every setting, so your local GP surgery can't have any Oxford in the fridge until it's got a -80-degree freezer installed, just in case they get a little bit of Pfizer?
No, our GP practices are currently using Pfizer, so it is coming to them thawed. The trickiness around that is it has to be used within 3 days.
Yeah.
So they don't need a -70 freezer. They are getting Pfizer now.
Right. Okay, but that's possibly been part of the delay that people have had in why, you know, in the whole of South East Cornwall, you can still only go to Pensilva, which is a long way from Saltash.
Yes.
Right. Okay. Thank you. That was a very helpful answer to lots and lots of questions. I'm sure everybody's ready for me to shut up now. Thank you.
Thank you, Colin. Councillor Farr, Andy.
Yes, thank you very much. I just really want to pay tribute to the work that's been done. I mean, it is an extraordinary effort. If we look back just a year really to when the start of this terrible pandemic, we've had the production of a number of vaccines now, 3 that are authorised in this country. Pay massive tribute to the scientists involved, and it does really bring hope. Also want to pay tribute to the existing healthcare structures that are obviously proving to be really good at delivering this vaccine. So looking at the GP surgeries, all the sort of clinical hubs that are delivering this, are doctors and nurses, or the administrators. It's an extraordinary effort. It does show how using the existing structures ramped up is a really good way of the NHS flexing itself. I think we also just need to be realistic that this is a huge challenge and there are lots of practical difficulties. I can understand why they're using the mass vaccination centres when you don't know whether you're going to get Oxford or Pfizer vaccines. It is very tricky, but I think on the ground it's been well received. My neighbours, a lot elderly, are delighted to have received the vaccine, and most people are very tolerant of a car journey and more than grateful to receive the vaccine in the hope that it provides. So I think you should hear that, Natalie.
Thank you.
I hate to think you came to sort of some picky councillors and you didn't get a really good thumbs up that it's an extraordinary work, and we're very grateful, and to pay tribute to all the staff that are delivering that. I've liaised with my local surgery to understand what's happening in Foy. one of the real practical difficulties, I think, and this may reflect some of the questions that's come from some of the councillors around how we deal with the housebound.
Yes.
So I think if you're over 80 and you can be given a lift to a centre, that's absolutely fine. If you're housebound, that's quite tricky. How are you managing that? That's a question. But mainly, I wanted you to hear tribute really to the extraordinary work.
AstraZeneca can be given in people's homes. So people who are housebound, it's what we call our mobile model or a roving model. So you'll hear different sorts of models, and people are going to have the ability to have the vaccine in their home. So we are still working through the sites at the moment, being able to get through more people if they come to a site. But if you can't come to a site and you truly can't come out of your home, the AstraZeneca vaccine can go to your home.
That's delivered by the local surgery then?
It can be the local surgery, or it could be our colleagues in CFT through district nursing, etc. So that model needs a bit of refining, but it could be done through either of those routes, really.
Great, many thanks.
Okay, thank you, Natalie and Andy. Councillor Sheila Lennox-Boyd. Sheila, you put your hand up.
Thank you, Chair. Nicholas, thank you on behalf of my in-laws who went to Silver, had both of their vaccinations over 80, it took 20 minutes.
Fabulous.
So efficiently done, but I have got, my mother is housebound. My local surgery has contacted me. I said it was much more dangerous for me to take her out if she was to fall because she broke her hip last year. But I'd just like to thank you for all the good work. And also I'd like to say, and I know Councillor Hawkin is on the line, that we have been updated, that there is another centre, and all the conversations with our community network officers have been very, very positive. But thank you for people. My mother also had a flu jab, and we have been really looked after. He's been out for a year, and things are absolutely brilliant. So can I just thank you?
Thank you.
Getting all the help, and from the public nurses, everything. Thank you very much.
Brilliant. Thank you very much.
Councillor Gammon, Jackie, you wanted to come in?
Yeah, I just wanted to reiterate what's been said, because I've been in touch with the Bodmin group of surgeries, and they are operating out of the old Ramsey Healthcare centre in Bodmin. They've joined with other surgeries in Lostwithiel and surrounding areas, and the reports I'm getting back from some of the patients as well, especially the over 80s, is that it's been really well received, and that it's well organised.
Thank you.
So that's a good thing for Bodmin and surrounding areas.
Thank you. Councillor Andrew Long and Councillor Lennox-Boyd, can you put your hand down, please?
Yes, thanks very much, Chairman, and thank you so much, Natalie, for such an in-depth report. It's really, really important. I also like to
Okay, thank you, everybody. Tracy, can you confirm that the live stream has now got with it, please?
Councillor Toms, at the moment I can't confirm that. I can confirm that the operator is just looking at it. So if you could just wait for the moment until we advise.
Yeah. Come back in when you've got that confirmation and then we can continue.
Lovely. Thanks, Councillor Toms.
Okay.
Councillor Toms, we've just had confirmation that the audio has been reset. So if we want to proceed, and if anybody gets any messages to the contrary, if you could just let me know as soon as possible. Thank you.
Tracy, it's back now. I've just got a text.
Oh, lovely. Great. Thanks very much, Councillor Kirkham. Thank you.
Thank you, Councillor Kirkham and Tracy, for your help on that matter. We'll go straight on to item 6, and Tracy Langley's going to introduce this, and this is the budget for 21-22 and the medium-term financial plan 21 to 25. Tracy, over to you.
Thank you very much, Chairman. I'm just going to whip through the sort of the overall part of the report, not in detail, as I know that you've seen a lot of this before, and then we have your strategic directors and Tracy not Tracy Stepney, Sarah Action Page, who's going to help with any of the detail. Councillors, you will know that this has been quite an extraordinary year for developing a budget. We have actually found ourselves in a position where we've been able to balance the budget for 2021-22, but not without some considerable hard work and some pain along the way. So if you remember, there was an outline budget gap of 36.3 million that we brought to you in September, and we have been working to close that gap. And you will see in the sorry, I'm just scrolling down the table 1, which is on page 21, how we have resolved that gap. There are a number of technical adjustments that we have been able to make. We've revised some funding assumptions as well, particularly difficult because of the difficulties we've had with ongoing grants coming in and losses against council tax and business rates, which we actually can't confirm until next year, really, when we see whether or not there is an impact from people losing jobs and businesses closing. It's almost impossible for us to make some judgments about that, but we've been able to revise some funding assumptions as well. There are already a number of savings that were approved last year, and you have been through those previously. There are 10.1 million for your overview and scrutiny. We have a number of savings on third-party contracts, which is in addition, and there is the impact of the voluntary redundancy programme as well. For adult social care and health, the overall amount of money that's in the detail of the budget that is in growth, if you like, i.e. the increased amount of money that will be spent in 2021-22, it is overall £21 million. But we have offset some of that with £10 million worth of savings, which means that there is a growth item in there of £11 million. Now, this is offset by the implementation of an adult social care precept, which we've talked about previously, and it is clear that this seems to be the way that funding for social care is currently, and you will have had conversations about that previously. There is also an additional social care grant in there, so that offsets in effect the £11 million growth. Chairman, I wasn't necessarily going to go into any more detail about the overall balancing of the budget, but your report gives you details of how that impacts on each of the areas in your purview. I hope that's okay. Hand over to my colleagues and yourself. And happy to answer questions, actually. You're on mute, Councillor.
Sorry, Ms. Charlesworth-May, do you want to come in?
Thank you. So as you know, I now wear two hats. So just to clarify for everybody, I am speaking to you unequivocally as the Strategic Director for Adults and Health in the Council. The budget process has been really helpful this year in enabling all of us to focus on what we're trying to achieve rather than what we have done in the past. In that context, the proposals that are before you for both public health and adult social care build on the changes that services have been making over the past 4 years. And the service directors will answer questions and will talk through the specifics as set out in the paper. In public health, our plans reflect our aim to ensure that people are supported to make good decisions about their long-term health and well-being. And in social care, supporting people to live as independent a life as possible, whatever their support needs, are the priorities that are underpinned here. And as you know, there is a lot of investment in extra care coming through, the expansion of domiciliary care and reablement, and the changes we have made to social care practice and policy underpin the proposals set out here for both services. In public health, I should note that the grant will not be increasing next year, and therefore the changes that we have made in our public health teams make it possible for us to make efficiencies which enable us to live within the grant whilst we continue to deliver the outcomes that we wish to deliver. However, I couldn't speak to you now without reflecting on the year that we are still in and the effect that has had on services both this year and next. First, I would like to say that staff in public health and social care have all worked unbelievably hard over the past year, and without their commitment, professionalism and expertise, we would not have managed this year. That doesn't mean that everything has worked as planned, but the teams have done a really good job. The second thing I would like to say is that the consequences of this year will be felt for a number of years to come in both of these services. And of course, with our local health services too. Unfortunately, we don't yet know what those consequences will be. And this uncertainty is actually the greatest risk for the department's budget and therefore for the council's budget too. I can assure you that as part of our plans in responding to the uncertainty, we are currently modelling the potential impact of the changes in demand on services so that we can see the direct consequences of COVID and, as part of the modernisation plan, address the changes that we will need to make. So to reinforce Tracy's introduction, it has not been easy to get to this place, and we know that next year will be difficult too. And for these services, probably every bit as difficult as the last year has been. I'm going to stop there and open up to any questions members would want to ask and ask the team to respond appropriately.
Okay, thank you, Helen. Any other officers wish to comment before we go to questions? Suzanne Wixie. Suzanne, do you want to come in?
Yes, that would be great. Thank you, Chair. Just really sort of building on the conversation in terms of Helen. I think sort of, you know, the service has been under extraordinary pressure, pressure that we have not seen the likes of before. And I think in relation to that, we have seen a surge in activity from post phase 1 and phase 2 of the COVID surge. So that is around safeguarding carers, mental health. We have seen additional pressures through the social distancing as well, sort of within the acute and community hospitals, pushing sort of demand out into the community, and we are having to look at how we redesign our services to respond to that. And also sort of the increase in demographics and the acuity of people coming back out into the community. And of course, we're in the 3rd phase of the pandemic now. So we are in extraordinary times, and in terms of the programme going forward, we are building on the Commenis programme, driving the efficiencies and focusing on strength-based practice to implement new ways of working, and my colleagues will talk to that in more detail. Thank you.
Thank you. Rachel Wigglesworth, do you want to say anything before we move direct to questions?
I think Helen's covered the main points. I mean, the public health grant, you know, we have to consume our own smoke. It's, you know, it's just 4% of the entire spending of the council. It's obviously prevention and investing in that element is limited by the allocation from the government within our current spend, and we've had to, all of our proposals are, you know, difficult decisions to work within our budget to get the best outcomes for the population.
Okay, thank you, Rachel. I have one question come in so far, and that is Councillor Bert Biscoe. Bert, please switch on your microphone.
Good morning, Chairman.
Morning.
I hope you're well.
Thank you.
I have a couple of brief questions and a couple of comments, if I may, about the budget. The first one is, I think, probably a general question for Tracy, which derives from looking at paragraph 4.2 on page 20. And that's looking at the medium-term financial plan. I think that there seems to be increasing attention being turned in the chattering world towards the possibility that inflation might rise. And I just wonder what mechanism or indeed provision we might have made in looking at our medium-term financial plan for that eventuality, which of course could have quite an effect on our budget. That was the first question. The second one relates to the bullet point just below that, actually, which permeates through quite a lot of the thinking around the budget, particularly as far as adult care is concerned, and that is when we talk about additional savings through the outcome of the voluntary redundancy process. No, sorry, additional savings that will be achieved through greater management of third-party spend. And a greater management of third-party spend means that we have a lot of agreements with voluntary sector bodies, we have a lot of contracts and so on and so forth. What I'm particularly anxious about and to get reassurance on is that this undertaking will not lead to us attempting to cap or indeed reduce pay for people delivering our contracts within the voluntary sector. I mean, voluntary sector pay is, in my view, always a critical issue. We're relying increasingly upon the voluntary sector to deliver things, and increasingly expert things, and yet we assume in the contract prices that they put forward a level of pay which does not compare with the level of pay that we would have to pay equivalent workers were they working in the public sector. And then the couple of points I'd make are these. The first one, and again, Tracy may wish to make a comment, I don't know. The first one is that it's very clear that the public debt, which is increasing rapidly, is deflecting the government from looking at the challenge of how we actually meet the care bill in future. And therefore, it seems to be, as in this year's settlement, falling back on local taxation. And local taxation, the local pit is not bottomless. And I'm anxious the extent to which we feel that we can push back against that tendency and press the government, even though it's got a huge debt burden, and and the work it's done to get us to this point in terms of managing COVID, I think generally speaking is extremely good. But we do have to address that challenge. We can't sort of just push it off on local communities forever. And then the last one is that in the proposed strategy to remove duplication of administrative functions and so on within the council, which seems like a very self-evidently sensible thing to do, but in following that strategy, it does seem to me it's really, really important, and this is particularly the case around care and all the services that we provide, that we do not underestimate the value of personal contact, of consistent engagement between individual officers and clients, so that people can form working relationships with their client base and so on. These things are incredibly important to the successful delivery of services, and I hope that is being recognised, and I think that it's on this committee really more than anything else to seek, if not to demand, assurance on that particular matter. Thank you.
Would you like me to answer, Chair?
Yes, just go straight into the answer, please.
Great, thank you, Councillor Biscoe. So on your question about inflation, yeah, inflation's quite a difficult one, isn't it? So inflation has reduced recently. We have no indications yet that it's going to go up for 21-22. So and inflation affects us in two ways. Firstly, in the grants that come into us annually from the government are inflated, and they have recently reduced that amount of money. So we've had to adjust our grant income accordingly. So that has reduced the amount of money coming in. In terms of our inflation that we pay on contracts and on pay bills and things like that, on contracts we tend to have very big contracts, and they tend to have percentage increases in them already, so we tend to budget for actuals. However, there is for local authorities, our inflation rates for what we pay for our contracts tend to be more than the average, so we will budget for more than the average, but it's quite a kind of technical piece of work, and it's done on line by line generally. So I hope that helps you with your inflation question. In terms of your question about the reduction of third-party spend, we spend 758 million a year on contracts, third-party spend, and all sorts of other sort of external money that goes out. We have to be able to manage that somehow, and what we are asking our commercial teams to do is to help support all of our services to make sure that we get extraordinary value for money from all of our contracts, and in some cases we don't, in some cases we do. So there's just a better piece of work to be more review our contracts more than we would normally do, and to make sure that we're getting good value. In terms of reducing therefore the pay within the voluntary sector, these things get done on a contract by contract basis, and it's not done without the help and support of the commissioners of the contract. So I would hope that that would be taken into consideration, and I'm sure it would be, because we've got lots of policies around that. In terms of your question about public debt, well, I think the first thing to say is that I don't know whether you've heard Robert Jenrick and Rishi Sunak recently, but both of them have talked about the need for local communities to help resolve the debt issue along with the government. And you can interpret that as we're expecting our communities to pay for this as well. So it is not unsurprising, given that we've got a 1-year funding spending review year, that they have continued with the adult social care precept, which has now been in place since 2016. Now, whether or not there will ever be something different that pays for adult social care and care generally is a matter that none of us can answer right yet. They've pushed the review and the green papers out so often now that I've forgotten how many times. So that's the public debt piece. And in terms of removing duplication, I think what we know now, so I've done many years of digitalising and making sure that contact centres have scripts. And what we know now, that the delivery of good services means the delivery to people of that service in the way that they need it the most, and that for many of our receivers of care is face-to-face and other contact mechanisms. So I am certainly not going to see our service delivery to people who need face-to-face be denigrated, but where we can, and where people are quite capable of digitally conversing with us, then we should encourage that. I hope that's that was quite a lot there. Sorry. Good questions though.
Okay, thank you, Tracy. Moving on, it is Councillor Sue Nichols. Sue, please.
Hi, thank you, Chair, and thank you for that. Yeah, I mean, this might fall between two papers here, and it's thanks to all the help and the support that people are getting from the ASC and from health and social care departments, because it is good. It's really just something that seems to be suddenly occurring, though it probably has only been brought to my attention on a couple of instances, and it has been dealt with brilliantly. But we seem to be getting people who are being discharged from hospital who we can't get a package for, who are being then admitted to care homes. And I know it's highlighted on page 26 at 5.3 and some paragraphs on from that, because these people are being discharged under NHS basically conditions, I presume, and they're being put there. I take it the NHS are paying for those 6 weeks or so. But then suddenly there seems to be no kind of like movement into going back to their homes, and the relatives are ending up having to pay for social care in a care home, and there doesn't seem to be any kind of like movement on that. So is this becoming a routine thing that's happening? And if so, under the integrated care system, I suggested the other day that it should be a 50-50 contribution from health and care into a pot, so that that can be divided out as necessary, not one or the other having priority. So I'm just wondering, how can we deal with that? How are we dealing with it, I think, is the question.
Yeah. Okay, thank you for that. I suspect that Suzanne or Jonathan might be able to answer that better than I can in terms of process. So I'll let them answer.
Thank you, Tracy.
Passing the rugby ball.
Thank you. So we are seeing increasing threefold pressure now of people coming through pathways out into the community. So yes, in terms of there is an increased pressure there, and we are redesigning our response to that. And I think sort of that's really important, that we get those timely reviews done and people being able to return to home as soon as possible. However, these are complex people often that go into homes or into services that perhaps aren't the right services for the longer term. So it is absolutely important that we undertake those short-term intervention, that those are short-term stays rather than long-term stays. The reviews are done, and that we wrap around the community services, not just adult social care, but health as well, in terms of getting those people back home as soon as possible. Jonathan, I don't know whether you want to say anything about the capacity in terms of the domiciliary care market. If not, sort of, I'm happy just to update on that as well. Okay, I'll update on the domiciliary care. So in terms of the domiciliary care market, it has been a challenge, and across Cornwall, getting appropriate and enough domiciliary care has been a real challenge and was identified through a transformation programme. However, 25% more domiciliary care has been commissioned, and if we did not have the pandemic, we would be in a far better position. But a lot of that domiciliary care is being eaten up by sort of supporting rightly those people coming out of the hospital. We need to make sure that there's oxygenated beds there, and we need to ensure that people get the right support. So there is a challenge for us around how we support that going forward, but the development of domiciliary care and reablement and the residential and nursing home care market is our priority, and making sure that we have enough resource to be able to respond.
Just to add to that, a little bit about the approach. So the approach to the latest wave of demand has been to very much approach that through D2A, which wraps around that rehab provision, looks to move people on within the 6 weeks. That's actually seen quite a significant investment in steps. So steps is very much at the heart of that, and that should see us start to move people home much more effectively. And then linking up with, as Suzanne mentioned, the 25% increase in home care provision this year, we should see our way through this, getting people at home as soon as possible.
Lovely, thanks.
Okay, thank you. Derek Hodnott has said he wanted to add something, if it was helpful. Derek?
Thank you, Chair. Just to follow on from what John was saying, that we've been working extensively with the market to try and increase the available capacity. John's indicated that we've actually been quite successful with that. We've just recently run a series of 4 workshops in different parts of the county. That has enabled providers to meet an additional 35 packages of home care support that they previously didn't believe they had the capacity to do. And that's through them working collaboratively in partnership with each other and using some of the digital mapping tools we have to show the demand more effectively, so they can make bids on packages that they're able to meet. Alongside that, we're also working with the market so that they can undertake provider-led reviews, which releases capacity from our frontline staff, who can be dedicated, as Suzanne was describing, to some of the more complex cases.
Thank you, Derek. Councillor Loveday Jenkins. Loveday.
Yeah, just as an aside on that issue, discharge from care homes and having a better systematic way of ensuring that people can be discharged from home from care homes, I think is really important. It's not been the situation up until recently, certainly, and so the more that we can put into that, the better. But what I wanted to raise the point on, or ask the question on, really, is the whole of the budget is predicated on the 9 million from the 3% adult social care precept, really. You know, if we didn't have that 9 million, what would be the impact on adult social care? I'm aware that there are a lot of people in our communities who are struggling at the moment and struggling with all their bills, and seeing the fact that they're going to be asked to pay higher council taxes, and even higher council taxes, in spite of the government supposedly announcing that they're putting a lot more money in. It's very difficult to explain to your residents that actually the government have announced there's more money going in, but that money is going to have to come out of their pockets. So what would be the impact if Cornwall Council didn't apply the 3% adult social care precept?
Thank you, Chair. I'll answer that question if that's okay. Thank you, Councillor Jenkin. So the impact in financial terms is £9.3 million, and we would need to find additional savings of that amount in the rest of the organisation, including adult social care. And if you take the normal approach of dividing that up proportionately in terms of savings, adult social care being the largest budget, would need to be finding those savings. Now, I would also say that I mean, of course, that's really difficult, isn't it? However, this, as you say, this is the way that the government have put the money into our core spending power in order to pay for adult social care. And by not accepting that precept, you would in effect not only be reducing the budget for 2021-22, but also the recurring impact in future years.
Yes, thank you. Just to come back on that, I mean, I know that. I just think it's useful to actually tell the public that it would be absolutely a huge impact on adult social care if we didn't accept the 3%. And that's notwithstanding the recognition of the impact on people who are already struggling to pay their council tax. But we do have some opportunities to support people who are struggling with council tax as well within the council, which I think is very positive. Just also on that, I suppose the issue for me, and I think there's been some amendments going on in the resolutions, is how we can actually make the point that this is a system that was going to change but hasn't, in terms of looking at the funding of adult social care.
Yes.
And that we need the government really to step up and actually go through with the changes to ensure that we do have a fair system of funding adult social care, which doesn't just depend on local ratepayers to do that, but is actually funded centrally from central taxes. So I would certainly support that being within our resolutions.
Okay, thank you, Loveday. Keith, you wanted to come in?
Thank you, Chair. I just wanted to make the subsidiary point, really. I think, picking up on what Tracy has already outlined, the impact on future years, clearly there is an impact there. What we are still trying to assess and sort of model out currently, and it is picked up sort of further down in the paper, is the additional rate of arrival, if you like, of people into social care packages as a result, either directly or indirectly, of COVID pressure, will have an impact into future years. And so it's not just a now budget pressure. We are going to have to understand really carefully what that impact is and what the lasting impact of that is. Clearly, we have opportunity, and we will have to work out whether we can kind of work with those service users to bring their level of package down over time, and as the market stabilizes, there may be opportunities there. But there are some really significant changes in the profile. So all the demand modelling work that we did through the course of last year, we're looking at again at the moment, and there's a really tangible and evident kind of shift in the demand profile coming through to adults at the moment. So I suppose to kind of partly answer Councillor Jenkins' question in terms of what's the impact, actually it's not just a now kind of impact in terms of that kind of 9 million and knowing that there is a pressure on the budget already, and with increased kind of volume coming through at the moment, it's a now and next impact that would be felt. So I just wanted to kind of just make the point, really. Thank you.
Okay, thank you, Keith. Helen Charlesworth-May, you want to come back in?
Yeah, so in response to Councillor Jenkins, and I think it's a question we absolutely have to be able to answer. So the plan that we have in place is really about trying to support as many people as possible in less intensive packages of care. The aim is to keep people at home, support them to continue to live in their communities so that the council effectively doesn't spend as much on each person. So that's a way of avoiding spending money in the future. If we have to make savings, actually take cash out, there are 4 ways in which we can do that. We can reduce the number of staff we employ ourselves. We can reduce the number of people who receive care from us. We can reduce the amount of care that each individual receives. And we can reduce the amount that we pay to the organisations that provide care on our behalf. And because most of that unit price goes on people working in the service, effectively it means reducing the amount providers pay to people who deliver services. So those are the only 4 ways in which you can deliver sizable savings in adult social care, and those are the things that we would need to look at and work out how we were going to do if we weren't able to see the increase that would come from council tax. And what I must emphasise is that the money that will be going into adult social care is not going to buy lots of new services. What it is going to do as a minimum is sustain where we are at the moment. So any other outcome will be extraordinarily difficult to deliver, certainly to deliver in 21-22.
Okay, thank you. Councillor Rothschild, did you want to come in on this subject?
Yes, please. Thank you. Apologies for late arrival, and I've been wanting to speak, but I've had dental work this morning, and I didn't want to appear on screen mumbling more than I usually do, or even dribbling, which would have been even more embarrassing. When the announcement came out about the decision to potentially add an extra 3% to the preset for adult social care, it was a bit of a dilemma for me, because I had this kind of issue around being a division member and being a cabinet member at the same time. So operating within a division where there is a significant degree of deprivation, poverty, and at the same time being the portfolio holder for adult social care, where I was really clear that we need every penny we can get our hands on. So it's a real dilemma for me, and trying to achieve kind of a balance myself with my own work and the people I represent, and doing the best for the directorate is a real challenge. But I did come to the conclusion that the answer was in fact to take the 3%, because next year, Tracy's already touched on, next year having to make £10 million worth of savings. Well, let me tell you, that's not an easy task. And if you look over the years of, certainly not just this administration, but previously, where adult social care has been tasked with making savings, to then say we've got to make another £10 million savings is a big ask. If you then add to that potential bill, or the lack of increase, if we don't have the 3%, is quite scary. And one of the things that Ellen just touched on was about the probable need to reduce what we pay our providers. For 3 years, I've been talking about the dilemma or the crisis in recruitment, in health and social care. And one of the sticking points has always been about the amount of money we pay, and we were proud to offer the foundation living wage rather than the minimum wage. And so that would be a risk. Again, that would be a risk. So recruitment's a challenge. Potentially then there is an even greater impact upon our ability to recruit, which kind of compounds the whole problem. There's also the long-term impact, and Tracy made the point that it's not just about this year, is it? It's about, it actually doesn't go into the baseline budget for the year after and the year after and the year after. So that's a real problem, and demand is escalating. But I'm not going to preach politics, because I don't. But consistently we've seen central government, not just this one, but consistent government after government, have failed to address the problem of how to properly fund adult social care. And personally, I object to it being passed to, and Loveday was absolutely right. You know, it's a problem. It shouldn't be passed to the local people, but that's the way that people have chosen to do it. So almost it's with a heavy heart that I'm saying that I absolutely am behind the 3% ring fence for adult social care. But I didn't get to that decision lightly, and I'm sure many of my colleagues feel exactly the same. Thanks.
Okay, thank you, Rob. Councillor Jane Kirkham. Jane.
Thanks, Rob. I echo what you were saying about your local residents and then looking at your department. It's a really horrible dilemma to be in. I've only been a councillor 3 years, but I already feel like it's Groundhog Day. Every single year this comes round, and every single year the government say, yes, well, Boris said on the steps of Downing Street, didn't they? Yes, well, I'll sort out social care in 100 days. And then every single year stick a precept on the most regressive tax that we have for local people, when we don't have the age profile to actually fund our social care through that tax anyway. It's very, very frustrating. It makes me very angry. They still have a month where they could cancel it. They could pull this. They could fund social care properly from central government, which is what they've promised to do. But I don't expect they will. So we're left in this horrible position again with 1-year settlements, with yet another precept that we are almost forced to put on local people that they can't afford. And it makes everyone very, very angry. I know it does. And we're not being compensated properly for the COVID costs, which, as were pointed out, a lot more people will need social care now than would have before. It's really affected social care in Cornwall. And of course, the public health budget as well. We're in the middle of a pandemic, yet not even an inflationary increase on the public health budget. It just makes no sense whatsoever. I had a couple of questions. Now I've finished ranting. I think the first one really is the savings that we're looking at making on demand management and cost avoidance are very high. 3 million stretch target of 2.9 million. You've talked a bit about steps. I'm assuming that steps and the work that Newton did will be the way that we will try to make those savings. I was going to ask about extra care, which seems to be a big part of future savings, a fundamental part, in fact. And I was going to ask, has that contract with Mears now been signed, and how are we moving ahead? Is anything happening? Are there any other extra care contracts that look like we may be actually producing something within the next 12 months? What was my other question? Oh yes, about the care home contracts, because we were looking earlier about Belitho in Penzance and the other care homes that that have been commissioned to cover discharge to care, step down care, that kind of thing. I wanted to know, for example, Belitho has been commissioned, I understand, by the CCG until this April under our current contract with care homes, and then of course it will change and it will standardise with the NHS one. I was going to ask, is that money to commission those step down discharge to care homes, is that coming from the council's budget, from the NHS? I know we've become an integrated care system, but we still have these separate budgets. So I wondered where the funding was coming from to do that. And I think that's all I've got to say. I've gone on enough.
Yes, you can come in, Tracy. You're on mute.
Yeah, thank you. If I can take the question on managing demand. So the 3 to 5 million is quite a lot in terms of managing demand, but we are building on the work that we put in place on the back of Comenis, and we will be in a position sort of where we are looking at, through our transformation programme now, considering our front door offer, what that looks like and how we make sure that we're maximising reablement at the front door and our other points of entry as well, because we've gone from 1 point of entry now to 4 points of entry into adult social care as part of the pandemic. So we are reviewing that at this moment in time to ensure that people are getting the right support going down the right pathway and maximising people's independence. It is not going to be easy, particularly on the back of the pandemic, but we do have a programme of work that will address that. Again, sort of in terms of prioritising our reviewing activity, releasing capacity back into the system as well. So that's another part of the programme as well. So we have our plans. We have ambitious plans, and we are in the midst of beginning to deliver those now, but it is going to be a challenge. And I'll pass on to John, who will probably pick up the extra points on extra care and care homes.
Hi, Councillor. Yes, so I mean, extra care is a key component of our approach to delivering better care in Cornwall in the future. Something that is sorely missing at the moment. So in terms of your question, has the contract been signed? Yes, pleased to say that has. We are busily working in partnership with that provider to develop that future plan and roll out as quickly as we can. We are looking at the other work streams around extra care, so perhaps an update to Scrutiny in the near future on that would be appropriate. In terms of the joint care home contract, yes, we're in this this period where we are onboarding to the new contract, which will be very welcome, and that will be from the 1st of April. So that's progressing well. The funding specifically to the Blytho development would be initially through the D2A money, so that is health money for 6 weeks. However, that funding stream does potentially pass some liability to the adult social care budget longer term, and there are slightly unhelpful clauses in the funding around voids, etc. So it's not a complete funding solution. I hope that answers the questions.
Okay, thank you, Councillor Kirkham. Councillor Martin Collins.
Thank you. I'm not sure if everything's showing up in my chat box that it was before. So as mentioned, I've been sharing the link for some draft resolutions. So I hope I won't go into too much detail. And then I can't see, is there anybody else waiting to come in to ask questions after me, or was I at the back of the queue?
You're the last one, and just me. I've got a question.
Okay, great. So I'll say my little thing, and then I'll tell you what the draft resolutions are, and then you can come back in if you want to chair. Obviously, it's up to you. Right. So to touch on a bit, I'll try not to repeat what's already been said. Thank you very much to all of the officers who've provided some very helpful briefings to this committee over recent weeks and months. I feel we're better informed about this year's budget than we have been in previous years, and I'm very grateful for that. I just want to get on the record some of the things that were said in some of those informal briefings. So in particular, could someone just spell out to us on the issue of drug and alcohol treatment? My understanding is the budget that's in front of us now shows that out of our funds, we're not able to put any extra money into drug and alcohol treatment, but by working across other departments, there's some money identified elsewhere that will be topping that up. And so if you could just say a word to clarify what that means, and I'm sure we're all very grateful that we've been able to do that. Another briefing we had very recently was about unpaid carers. And I think it's really important that we recognise the enormous value that those unpaid carers have for the whole system. And then finally, there's concern about the public health budget having been cut over recent years, then leaving us exposed for the pandemic. So if I just let you, do you want to come back to me on that point about the drug and alcohol funding, and then I'll tell you what the draft resolutions are that people have written out.
Chairman, I'm happy to answer that question. Yes, you're absolutely right. What we've done is we've worked across the organisation to ensure that the budget shortfall was met through environments from other budgets. So that has been enacted, and you will see hopefully the detail of that in the detail of your papers.
Thank you. Now, Chair, I don't know whether you're able to see the draft resolutions on your screen, so it's entirely up to you. Do you want to ask your question first and then hear draft resolutions, or do you want it the other way around?
You can do it now, because I'm sure my two questions won't make any difference to the resolution.
Okay, so as I say, this has been sort of written collaboratively, and I can still see cursors flickering around on there now, so hopefully it won't change too much as I read it. So the draft resolutions are, first of all, number one, and Leanne, this is all in writing, so you don't need to write it all down as I say, I'll share it with you. Number one, that the committee notes the underlying financial assumptions contained within the balanced budget proposals for 2021-22 as set out in this report, especially the impact of COVID-19, and refers them to Cabinet. The committee also restates its commitment to the principle that everyone working in a council-funded role must be paid at least the foundation living wage. Number two, for the services within the remit of this committee, the committee notes the budget proposals for the financial years 2021-22 to 2024-25 and refers them to the Cabinet. Number three, the committee commends the entire adult social care workforce for their work to increase the efficiency of care provision, working with the NHS to ensure that as many people as possible get the right care in the right place at the right time within the limitations of the resources available. Number four, the committee deeply regrets that despite many years of promised funding reform for adult social care, the burden continues to fall on local authorities and their local council taxpayers, with an additional precept on council tax every year since 2016. In Cornwall, we have a super aging population, and we can never achieve enough funding that way. The committee notes that the cost to Cornwall Council is now almost £200 million per year, equating to around £1,000 on the average council tax bill, and that demographic demand for services is increasing year on year. The committee calls on the leader of the council to press the government to address this issue with immediate additional central funding in the March budget, as well as long-term reform within 12 months. Number five, the committee welcomes the cooperation across departments and organisations, which has allowed funding for drug and alcohol treatment to be topped up without taking resources away from other health and social care services. Number six, the committee recognises the vital role played by unpaid carers and personal assistants, without whom the whole health and care system in Cornwall would collapse, and calls for the funding allocated to support these heroes be increased as a proportion of the total adult social care budget over the next 5 years. So that's not a change to this year's budget, but it does have implications to be resolved in future years. The committee notes, and finally, number seven, the committee notes with concern that years of cuts to the public health budget left Cornwall without the resources it needed to deal with a pandemic, and calls on the leader of the council to press the government to set out a clear, fully funded plan for pandemic preparedness. So sorry that was very long, but I think it probably saved us about half an hour of debate. So over to you, Chair.
Okay, thank you. Councillor Nichols, you want to come in?
Yeah, thank you, Chair. I think that's rather a long rhetoric, and it seems very politically minded as a resolution for this the committee. So I would like to see that certainly cut down to something that actually is portrayed in the document and not just rhetoric. Thank you.
Okay, thank you. Thank you, Councillor Nichols. If you have any amendments, please look at the document. Councillor Bert Biscoe. Bert, you wanted to come in.
Yeah, thank you, Chairman. Well, I have some sympathy with Sue Nicholas's point that it is extremely long and could be boiled down, and some of the language is a bit emotive. But the key for me is in the section that is talking about the council tax and pressing government to search for another way of dealing with the funding. I think that there's a phrase in there that talks about removing the burden from, or something like this, removing the burden from local government, or leaving the local government with the burden. I think it's probably true to say that it's a good thing that local government is engaged in the process of delivering social care. I think the problem is that we seem to be moving away from the idea that the financial burden should be a shared burden between local and central government, and maybe other sources as well, who knows. So I would just like to ask if we could have the word, I forget what the phrase is in, I haven't got the text in front of me, but that we could have the word whole, so when it's talking about removing the burden, or shouldering the burden, shouldering the whole burden, having local government shoulder, I don't think we want to get out of doing with it altogether. I think what we need is support rather than us stop being involved in it. So I would like to see that. I'm sorry, I can't remember the phrasing, but all I wrote.
That's okay.
The word whole.
Would you like me to read that sentence out again to see if Councillor Biscoe wants to propose an amendment?
Yes, or just an addition.
If that's all right with the chair, then so the I think Councillor Jenkins has just inserted some magic words there. So it now reads: the committee deeply regrets that despite many years of promised funding reform for adult social care, the majority of the burden continues to fall on local authorities and their local council taxpayers. Are you happy with that as a tweak, or does that not really get to the point you're trying to make? Sorry, I can't hear you now, but if you're answering.
Councillor Biscoe, do you want to come back in, Councillor Biscoe?
I just think we should emphasise that it needs to be a shared burden rather than leave the sense that we're trying to get shot of it altogether. So how that's done.
Sure. So that's always the bit that gets tricky at this point in the meeting. Is I propose some words and they're not my words. They're a collaboration of several councillors who've been writing them there in the background, and I fully accept that has meant they're quite long. So the wording has been changed to say the majority of the burden continues to fall on local authorities. If you're happy with that, so would it? Am I able to share them on screen, Chair? Would you like me to share them on screen so people can all see what we're saying?
Yes. Councillor Nichols at the moment can't see the I can't see the words. Link isn't working, so can you share it?
Okay.
Is that okay with you, Councillor
hopefully Nichols? Yeah. Can you see that on your screen now?
Yes, we can.
Yes, Chairman.
Okay, so again, apologies, it's very long.
Thanks, Colin.
I'm proposing those words as they're written, but obviously I'm open to anybody wanting to suggest any specific amendments.
I'll second that, Colin. It's Jane.
Councillor Farr, you wanted to come in. Is there anything you want to say specifically about this, or do you want to add something?
Yeah, no, it's thank you very much for letting me come in. Obviously, you know, we do set ourselves out as a non-political committee. Although I'm very happy to second comments about long-term social care funding. I'm very happy with that. I'm not sure this committee this morning has heard evidence that would support items 6 and 7. I think they are viewpoints rather than a reflection on evidence that we've received this morning. So I think points 6 and 7 should be removed, please.
Okay, thank you, Councillor Barr. I'll take that as an amendment. Councillor Nichols, you wanted to see this. Did you have any comments, please?
I have got it now, thank you. Yeah, thanks for sharing that, Colin. Yeah, I actually agree with Andy. Those are the two that I think aren't particularly relevant to what we've done. Thanks.
Okay, thank you. Councillor Barr, do you want that to taken as an amendment? So will you take them in two slices, 1 to 5, and then 6 and 7 as a separate entity?
Well, unless people are willing to withdraw 6 and 7 after a challenge I mean, I'd love to hear what the evidence that we've received this morning that the public health budget is impacted on the Cornwall response to coronavirus. That's a huge statement, isn't it? I'm not sure we had any evidence to justify that one way or the other.
Okay, thank you. Councillor Kirkham, I think you wanted to come in.
Yeah, just to say, I note what Councillor Ver says. I would say that there has been quite a lot of evidence over the past 10 months, things like not having any PPE and having to spend £600,000 of the council's own money and various things like that to back up the fact that the public health budget has not been enough to deal with the pandemic. So I would probably want to keep something, certainly something in our recommendation, to point out that the fact that there is an effective cut in the public health budget next year in the middle of a pandemic is a very bad thing.
Okay, I think Councillor Ver, did you want to come back in? I saw you.
Yeah, I just think to be a serious committee, we need to have conclusions based on the evidence we've received this morning. That is the purpose of our committee. I mean, I'm not sure I really want to go into debate on the impact of the public health budget over the last year. I think we could have that debate. We haven't had that debate this morning, and therefore we're doing this committee disservice by including measures which we haven't debated and agreed this morning. So I feel very strongly that 6 and 7 should be withdrawn. I think we are. I'm concerned about the integrity of our committee.
Okay, thank you. Councillor Sally Hawking.
Thank you. On that last point 7, I know this is the committee's business to work out what they're saying, but I do think that I probably agree that there needs to be a distinction between the public health budget, which is being cut, and that's not something I'm obviously supportive of, and it would be helpful to not have cuts to the public health budget, and the response to pandemic, because I think we've heard before that things like PPE shortages are not something that would have been covered by any public health budget. They come through other routes. So whilst it might be the case that there were issues nationally around shortages and whether we were pandemic prepared, it wouldn't necessarily be that some of the things that people are thinking of there would be things that would be covered by the public health budget as such. It's the LRF, it's other forms, isn't it? So I would probably agree that there's something not quite right about that last bit.
Okay, thank you. I'm just looking. Councillor David Parsons wanted to come in. David.
Yes, thank you. I'm inclined to agree. 7, certainly. I don't think we've not really focused on that this morning, and I'd be quite happy to make that on a separate occasion. 6, I think, could be compressed down to the committee recognises the vital roles played by unpaid carers and personal assistants. Without who, so the last bit I think is probably again a bit outside what we've debated this morning. 5 is okay. 4 I think is probably wordy, but perhaps it says what we want to do. Can I propose, if we're going to vote on this, we just vote on 1 to 5 and then 6 and 7 separately as a quick way through this, rather than going over the same ground time and time again?
Okay, thank you. Yeah, that's what I proposed at the offset, David. Councillor Loveday, Councillor Jenkins.
Yeah, I was just trying to put in the form of words that might be able to help with 7, that we take out the years of cuts. I've put it up on the screen and say that the cuts could leave Cornwall without the resources it needs to deal with possibly a future pandemic. And then, we do need a clear, fully funded plan for pandemic preparedness. So I wonder whether that would solve the concerns. I've highlighted it in yellow.
To be honest, Loveday, we have 3 councillors now showing concerns about 6 and 7. I think if you're going to take them separately, Chair, if you can, I could put them in as an amendment for 7 when we get to it. Yeah, 1 to 5 is one vote, and then 6 and 7 is separate votes. Councillor Ellenbrook, I think you've indicated you wish to speak.
Yeah, thank you, Chair.
I would support that if that is a proposal from you, that we vote on 1 to 5 as one lot of amendments or proposals, and then do 6 and 7 as a separate one, and stop tinkering with stuff and just get on with it. I mean, this is about the budget. This is not an opportunity to make political statements, frankly.
Councillor John Pollard.
Thanks, Armin. I'm sorry, I put 2 X's in because I thought you'd forgotten me. I'm going to not help by suggesting we take 6 and 7 as 2 separate items at the end, because certainly as far as I'm concerned, we have been talking about the budget. I take Andy Ver's point. We have been talking about the budget, and therefore the committee notes with concern the continued cuts to public health budgets, whatever the purpose of that budget. I think is a legitimate thing for us to keep emphasising. 6 is just for me overblown and too linguistic, and therefore I'm just asking we do 1 to 5, and then we do 6, and then we do 7.
Okay, I think that's fine. I think we come to some sort of agreement. Leanne, would you take over? We'll do the vote from 1 to 5 and then 6 and 7 separately, if we can, please.
Okay, thank you for that. So I have the proposal as Councillor Martin and the seconder as Councillor Kirkham. I am now going to try and read from the screen what's written in front of me, and then we will go to the vote. So we will have 3 votes. One is on 1 to 5, then there will be a vote on 6 and a vote on 7. Is that everyone okay with that? Okay, so proposed by Councillor Martin, seconded by Councillor Kirkham, that the committee notes the underlying financial assumptions contained within the balanced budget for 21-22 as set out in this report, especially the impact of COVID-19, and refers them to the Cabinet. The committee also restates its commitment to the principle that everyone working in the service, council-funded roles must be paid at least the foundation living wage. 2. For the services within the remit of this committee, the committee notes that the budget proposals financial years 2021 to 24-25, 21-22 to 24-25, and refers them to Cabinet. The committee commends the entire social care workforce for all their work to increase efficiency of care provision, working with the NHS to ensure that many people as possible get the right care in the right place at the right time within limitations of the resources available. The committee deeply regrets that despite many years of promising funding reform for adult social care, the majority of the burden continues to fall on local authorities and their council taxpayers, with annual addition precept on council tax every year since 2016. In Cornwall, we have a super ageing population and we can never achieve enough funding that way. The committee notes that the cost to Cornwall Council is now almost 200 million per year, equating to around 100,000 on the average council tax bill, and that the demographic demand for services is increasing year on year. The committee calls on the leader of the council to press government to address the issue of the immediate additional central funding in the March budget, as well as the long-term reform within 12 months. 5. The committee welcomes a cooperation across departments and organisations which has allowed funding for drugs and alcohol treatment to be topped up without taking resources away from other health and social care services. Right, everyone knows what they are voting on, I hope. So 1 to 5, and I will go through roll call on those. So Councillor Biscoe.
I am for.
Thank you. Councillor Chapak.
I am for.
Councillor Ellenbrook.
I'm abstaining.
Councillor Gammon. Councillor Gammon.
Oh, sorry, I'm for.
Thank you. Councillor Jenkins.
For.
Kirkham.
For.
I believe Councillor Lennox Boyd has had to leave the meeting. Councillor Martin.
For.
Councillor Nicholas.
I'm abstaining because I think the wording for isn't quite right.
Thank you. Councillor Parsons.
For.
Councillor Pollard.
Oh, sorry.
Councillor
For.
Pollard.
4, sorry.
Councillor Thomas.
4.
Councillor Toms.
4.
Councillor Ver.
4.
Councillor Williams.
Voting for.
Thank you. So, Chairman, 14 members eligible to vote. In that, 12 were in favour with 2 abstentions.
Okay, thank you. Carry on with 5 and 6, please.
Okay, so Councillor Martin has indicated he wishes to speak. Chairman, are you happy to bring in the Vice Chairman at this point?
Only if it's, you know, equates to item 5.
Sorry, number 6. Yeah, we're talking about number 6 now. Yeah. So Councillor Ver is absolutely right that we haven't heard anything in today's report about the detail of support for carers. The point I was trying to make was that we've heard informal briefings in order to prepare us for this. That's not on the public record, and not all councillors have managed to attend all those public briefings. But I still thought it was important to address that issue. It doesn't affect the budget for this year, but my concern was that year by year, the support for carers gets squeezed and squeezed and squeezed, even though we depend on them more and more. So simply, A is a recognition of their value, and B is turning that sort of motherhood and apple pie statement to something concrete by saying actually we can't continue to squeeze the proportion of how much we spend on supporting those unpaid carers is ahead. But if people don't like it, they can vote against it.
Okay, thank you. Leanne, over to you again.
So, as previously proposed by Councillor Martin, seconded by Councillor Jenkin, it is the committee recognises the vital role played by unpaid carers and personal assistants, without whom the whole health and care system in Cornwall would collapse, and calls for funding to be allocated to support these heroes to be increased as a proportion of the local adult social care budget over the next 5 years. Everyone is happy with that. I'll move to the vote. So, Councillor Biscay.
Well, I suppose I'm in favour, but I don't like the word heroes.
Councillor Chopak.
I'm not happy with the wording, so I'm going to abstain.
Councillor Ellenbrook.
I have the same concerns. I'm not happy with the wording. I abstain.
Councillor Gammon.
I will support it, but I would like to see the word heroes changed. I don't think it's appropriate.
So are you proposing an amendment to that, or is it just a caveat that?
With respect, Chairman, it's too late. The vote's being taken.
Yeah, I'd just like it registered that whilst I support the principle, I don't like the word heroes.
So could you confirm if you're voting for, against, or abstaining, Councillor Gammon?
No, I'm supporting it. I'm voting for it.
Okay, thank you. Councillor Jenkin.
For.
Councillor Kirkham.
I'll vote for as well.
Councillor Lennox Boyd is left the meeting. Councillor Martin.
For.
Councillor Nicholas.
I'm abstaining because I don't like the wording either.
Okay, Councillor Parsons.
I'm abstaining too, same reason.
Councillor Pollard.
Abstain.
Councillor Thomas.
Abstain.
Councillor Toms.
Abstain.
Councillor Ver.
Abstain.
Councillor Williams.
Abstain.
Me just my auto sum thing doesn't work when it's an additional one, so I need to actually count them up. So we've got 5 in favour.
7.
And 9 in. Hang on.
Abstentions.
Yeah. And 9 abstentions.
Okay, thank you. And the last one, number 7. Thank you.
Oh, sorry, we've got Councillor Hawkin and Councillor Vera have just indicated they wish to speak.
Okay, Councillor Hawkins and Councillor Barr.
Thank you, Chair. I think if it would be helpful, I think the bit that I would say to the committee is that the expected public health grant doesn't provide resources to deal with the health and wellbeing of the impacts of the pandemic and respond to future public health challenges, including pandemics. So that is a statement that I think is factually accurate, if that helps in your discussion about item 7.
Okay, thank you. Councillor Barr.
Yeah, I apologise. I feel very frustrated that we've got to this point where we now cannot be united as a committee as we have been in the past, and I feel that the chair and the vice chair need to go away and reflect on what's occurred, and that we've been asked to vote on amendments based on evidence we've not received as part of the committee, and I think we're failing as a committee, and I want to voice my deep disappointment that we've got to this point. And I'd like the chair and vice chair to reflect on how this has happened as you lead us in these amendments. I think we've been failed. Sorry.
Okay, thank you, Councillor Barr. Was one other.
Chairman,
Councillor Jenkins.
Oh, right, sorry.
Yeah, I was just going to propose the amendments that I proposed, which was that that the cuts to the public health budget could leave Cornwall without the resources it needs to deal with a future pandemic. Because this is that we obviously I recognise what Sally's saying about there are other issues within the budget as well, but the public health budget that will be impacted. But this was specifically in relation to getting a clear, fully funded plan for future pandemics.
Thank you, Councillor Jenkins. Councillor Nichols, you've just come in.
Yeah, thank you. And I'm echoing Andy's concerns as well about this. I think item 6 could easily have been put in that the committee recognises the vital role played by unpaid carers and personal assistants without whom the home health and care system would collapse. I think that's a very good statement, and I think it's a statement that most of us would support on that. It's a shame that we got to the other parts of it. Regarding 7, I totally agree. There has been no evidence. It's been very spasmodic about whether PPE was available or not. In my area, it was available and nobody seemed to be having any problems with it. So I think 7 should be removed. Thanks.
Okay, thank you. Leanne.
Sorry, Ahmed, I
sorry, John.
Twice.
I'm trying to work 2 screens here, John, and I'm missing things. John Pollard.
I understand the difficulty, but and I'm sorry to have to remind you. I was going to fully support Sally Hawkins' statement. The wording that she put to 7 I thought was appropriate, measured and accurate, and totally to do with the budget. And therefore I would like to propose that wording.
And which I will second, Chairman. Right.
Okay. That becomes that becomes the first vote. Leanne, did you get the amendment that was given by Councillor Hawkins?
I didn't, because I was doing the other stuff. So okay. If Sally can read out what she said again.
Okay, I guess PPE shortages were real, but not the responsibility of the public health budget. That's kind of the bit where I think the committee is getting, 2 different things confused there. But in terms of the bit I made, the comment I made earlier, which I think Director of Public Health would also be content is factually accurate, is that the expected public health grant does not provide resources to deal with the health and wellbeing impacts of the pandemic and respond to future public health challenges, including pandemics.
Councillor Pollard, you're willing to take that on?
Yeah, very much so.
And Councillor Biscoe, you're going to second that?
Very much so.
Okay, thank you. Leanne, it's now up on Well,
sorry, I've got half of it on the screen. So Councillor Hawking, I think you said the expected public health grant does not provide resources to deal with the health and wellbeing impact of the epidemic, and then he said something about
what the expected public health grant does not provide resources to deal with the health and wellbeing impacts of the pandemic and respond to future public health challenges, including pandemics. It's a reducing pot and expecting it to be meeting some of those future needs will be difficult.
So that is
that is what's been proposed by Councillor Pollard and seconded by Councillor Biscoe. Shall we go to the vote, please, Leanne?
Could I make just one small suggestion, Chairman? That at the front of that sentence you put the committee notes with concern.
Agreed.
Yeah.
And,
okay,
and if I'm happy to, rather than voting on an amendment to this, I'm hoping that I can incorporate this wording into what was already there. So can I try? I'll talk through it as it's on the screen. So the committee notes with concern, and then I'll insert the words that Sally Hawking has just read to us. The committee notes with concern that that the expected public health grant does not provide resources to deal with the health and wellbeing impacts of the pandemic and a response to future public health challenges, including pandemics. So therefore, I'll delete the next bit that I wrote, but leave in calls on the leader of the council to press the government to set out a clear, fully funded plan for pandemic preparedness. So obviously people
I don't think that was part of Sally's statement.
No, it wasn't.
Remove it, please. I'm not proposing that. I'm proposing Sally's statement in its entirety.
Yeah, and I agree with that. I think that what is currently on the screen, Chairman, has got an inner tension, because actually what we're saying is we haven't got enough money to deal with public health, so the government set up a fully funded plan. That's two completely different things. Okay. So I agree that we should draw to the attention of the Cabinet and the Council that there is concern about the expected public health grant. And that statement, that seems to me to be perfectly reasonable and sits within the budgetary debate that we've had this morning. I think if the leader concludes, or people go to the Cabinet and suggest to the leader that he may like to take that up, then that's a different issue.
Okay. Councillor Nichols, you indicated in the box.
Yeah, because I agree with what John and Bert suggested, but I don't agree with all that other stuff that Colin put in. So I think Sally's statement is perfectly reasonable and the rest needs to be removed.
Okay, and that's how it will stand, because Leanne?
Chairman, I'm just trying to work my way through the confusion on the changes. So we'll take the vote on the amendment first. That is the one proposed by Councillor Pollard, seconded by Councillor Biscoe. For accuracy, there is a number 7 that's been added to the screen, which is the committee notes with concern that the expected public health grant does not provide resources to deal with the health and wellbeing impact of the pandemic and respond to future public health challenges, including pandemics. Councillor Pollard, is that the recommendation that you are proposing?
Absolutely. I'd like to see 8 removed from that box, please, because I think that's confusing.
Okay. Councillor Biscoe, is that the recommendation you are seconding?
I can confirm that, Leanne.
Thank you. Okay. We're happy to move to the vote on that amendment. Is that okay with the membership?
Yes, carry on, Leanne.
Okay. Councillor Biscoe.
It's 4.
Councillor Chopak.
4.
Councillor Ellenbrook.
4.
Gammon. Could everyone turn their microphones off, because I'm getting really quite bad feedback. And I'm not sure members can hear me. Thank you. Councillor Gammon?
4.
Thank you. Councillor Jenkin?
4.
Councillor Kirkham?
4.
Councillor Lennox Boyd has left the meeting. Councillor Martin?
4.
Councillor Nicholas?
4.
Councillor Parsons?
4.
Councillor Pollard?
4.
Councillor Thomas?
4.
Councillor Toms?
4.
Councillor Ver?
4.
Councillor Williams?
4.
So that is all in favour for that amendment.
Okay, thank you, Leanne. Councillor Martin, do you want to remove item 8?
Well, I don't particularly want to, but I think in the interests of ending on a united note, I'm prepared to withdraw that last point. I'm very grateful to everybody who's joined in with that way of doing them. I know it's different to how we've done it in the past. I fully accept that the wording that we'll come up with is a bit more than we might have had previously, and it reflects the fact that, you know, 3 or 4 councillors wrote most of the words there, and then other people kept quiet until the end with their concerns. I hope that people have seen that, well, you know, we can all work together to get something we'll agree with if we do it in the right order. So I'll withdraw what's left and we can move on.
I just make the point in response to that, that it works when it's on the screen. It doesn't work when it's a separate piece to me. So I think that's the reason why people didn't come in until the end, Colin, because it didn't really work for me until it was the whole thing was visible on the screen shared by you.
Oh, okay.
And as I said, Colin, to Councillor Pollard, I'm trying to work 2 screens here to see what's coming up on the chat, and I have got no other screens to see what's on that list. Okay, thank you. Right, can you remove it from the screen at the moment, Councillor Martin? I'll be advised by Leanne about taking the next item or having a short break.
That was going to be my question, Chairman. We're now at 2 minutes past 1. The live stream handover will have to happen at 2 p.m. It takes a few minutes to do that. We currently have so the adult social care charging policy, we have the workforce update from cabinet members and questions, and then updates from the chairman and vice chairman. So in order to give due debate for the formal items that we have, I don't think we're going to manage that in an hour. So it's whether or not the committee wishes to continue to the next item and then break, or break now and come back, but you will have to have a break just before 2.
Okay, thank
it's
you,
only for
Leanne.
a few minutes change over.
Any of the committee have any preferences? Take the next item and then have a break, or have a break now and take the next item? Break now, please, from Councillor Parsons.
Now, please.
Yeah. Okay. Is 20 minutes long enough for everybody?
No.
Or half an hour?
Go on, give us half an hour.
Half an hour would be good.
Go on.
Okay, half an hour. We'll come back at past for everybody. Remember to turn your cameras off and turn your microphones off, please.
Thank you, members.
Good afternoon, everybody. I hope you're refreshed after your short break. Shall we restart the meeting? Leanne?
That's fine, Chairman. It's the live stream link is still running.
Okay, thank you, Tracy.
Okay.
Okay. Go straight on with the next agenda item, which is the adult social care charging policy. I think have a look. Charging policy is Derek Hodnott, and Keith, are you in with this as well?
Yeah, thank you, Chair. I'll leading with a couple of comments and then pass to Derek. So in front of you today is a report about the process and consultation which ended on the 11th of November last year, together with the draft policy surrounding adult social care charging policy. The revised policy is due to be considered by Cabinet on the 10th of February, so we're passing through here for your input, thoughts and comments, which would be helpful. Purpose of the paper is to provide feedback on the consultation, explain the impact of the main changes, and as I say, involve the committee in consideration of which changes should be recommended for implementation from April this year, 2021. The changes we're proposing are very much normal practice in most other authorities around the country. I would recommend them wholeheartedly, but I will ask Derek to take you through this. Derek's been leading the work and can give a kind of a steer through the document for you. Thank you, Chair.
Okay, thank you. Derek.
Thank you, Chair. So I won't go through the paper in excruciating detail, but I will set some context and explain that the current adult social care charging policy is now 5 years old, so it's significantly out of date, and as Keith has mentioned, it is out of sync with the approach taken by the majority of other councils. We developed our approach is consistent, fair and equitable, and partly achieving that is done by having
Mr. Hodnott, your sound keeps on breaking up. Can you just put your video off and see if that helps your bandwidth to talk to us? I think he's frozen right out.
Yeah, thank you,
Tracy, any advice on this one?
Yeah, bear with me. I've got some notes that I can probably sort of help steer us through.
Chairman, it might be helpful if Derek left.
Can people hear me now?
Oh, there we go.
Hello?
Yeah, leave your video off and just use your audio, please, Derek.
Hello, can people hear me now?
Yeah, we can hear you. Just can you keep your video off and just use your audio and see if that works?
Yeah. So I'm back here now. Sorry, so I had a Wi-Fi problem. So I'm not sure how much of that people heard, but so our approach we've taken is to make the document clearer and easier to understand, and that's both for our customers but also for our staff. So our approach is always consistent, fair and equitable. It's also, as Keith has pointed out, to make sure to bring us in line with the policy approach taken by the majority of other UK councils. As part of the preparation for this policy, we did consult with a large number of other authorities to ensure that we were consistent and in line. The main changes that we're proposing within this policy document is there are 4 changes. The first of which is in relation to the date from which we will start charging for home care. Our current policy position is that we do not start to charge until we have completed the financial assessment, and that can be a significant gap between the date that services start and the date we start charging, which is a reduction in council income. So the proposal is that we will start to charge from the date that services commence. 100% of the other councils who we spoke to already charge on that basis. The second change is in relation to respite charging. We currently apply home care rules, which means that we assume that the person is continuing to have the same costs that they would incur whilst living in their home. And instead, we're proposing to use the short stay care home rules, which assumes that they are not staying in their home whilst they're on a respite break. 70% of other councils take that approach. The third change is in relation to subsidising meals. We are proposing that the full cost of meals should be charged as opposed to the current subsidised rate of £2.50. This now affects very few people as the council no longer provides meals within its day centres. However, there continue to be 44 people that have a subsidised meal in the county, and we're proposing that that should stop. Again, that's just over 70% of other councils we spoke to have that same approach. The final change is in relation to arranging services for self-funders. So people who are responsible for 100% of their adult social care costs have the right to ask us to arrange those services on their behalf. So that means finding a provider, entering into a contract, and then managing that contract relationship over time. The majority of councils, again, 75% of the ones we spoke to, already charge. The 25% who don't already charge are proposing to introduce that charge. We're proposing to introduce a charge of £300 for providing that service, which relates to the cost of us doing that work. There is not a profit margin in it. Looking at other councils, there is a range, with the average being £400 for providing that service. The policy also reinforces our commitment to offering a self-service option for clients who prefer that as an approach to dealing with the council. That was heavily supported within the consultation process, with in excess of 70% of people supporting being able to use a self-service solution. The consultation itself was a 5-month period of consultation. We extended that from the originally proposed 3-month period to take into account the fact that we're in a pandemic and a number of people are under significant pressure and needed more time to be able to consider our proposals. We provided a range of materials to help people understand what we were proposing to change and to let us know what they think. And that included an easy read summary of the document and a sorry, it's my dog in the background, and a video which set out and explained how we were consulting and the changes taking place. We raised awareness so people could take part with a variety of approaches, including direct mail, social media, mainstream media, and also with the help of our voluntary and community sector organisations in distributing this information. We had significant online engagement. In total, across members of the public and other organisations, we ran 48 online webinars, and we also undertook significant telephone engagement for those people who are unable to join the webinars. In response to that, we have had nearly 360 responses to the survey, with the majority of people thinking that we have achieved our aim of making the policy easy to understand. We had mixed responses on the key changes that we are recommended, with the majority of people supporting the aspiration to charge for home care from the date services start and removing the subsidy for meals, and just under 50% of people supporting the introduction of self-charge for self-funders, and 35% of those for the change in respite. The context for those figures is that the one main comment the majority of people made was that adult social care should be free at the point of delivery. And so it's quite natural that when you're looking at survey responses, you are going to get a disproportionate number of people who will not support the introduction of new charges. It's important to mention that the starting point, changing the start date for home care charges, and the charge for self-funders will only affect new clients. The others, the removal of the subsidy, will affect 44 people who currently receive that support, and it's just under 200 people for respite. All of the changes that we are proposing are in line with the CARE Act and national government charging regulations. And as I've mentioned already, is that they're in line with the approach taken by the majority of other councils in the country. In terms of mitigation, we will always take a personalised approach for the impact of these changes, and we would not make any change to an existing client's charges without undertaking a revised financial assessment to ensure they remain payable. Chair, I've gone through an overall summary of the paper. I haven't gone into the absolute detail, but I'm very happy to take any questions.
Right, members, any questions from members, please? Councillor Biscoe.
Chairman, I trust you enjoyed a hearty lunch. I wanted to just ask a question and make a bit of a point, really, about charging self-funders for arranging care. It seems to me that part of what people buy when they pay their council tax is a duty of care by the local authority towards them across a range of disciplines, whether that's road safety or food safety or getting their dustbins emptied or whatever. But part of that is also that they do buy an engagement with adult care, with social care. And that people's ability to do things is a significant determinant about whether they can take on, the arranging of their own care needs or not, and knowing where to go, particularly if they don't necessarily know their way around that particular area of life and provision, can be quite bewildering and quite difficult, and not without its risks. And it seems to me that if you're somebody who, for instance, has paid their council tax for 30 years, and suddenly, after 30 years of getting their dustbins out, etc., there comes a moment when they need a bit of advice from adult care about putting together a care package, which they intend to pay for themselves. It does seem to me to be something that they might expect that they've paid their dues in order to receive, particularly if they want to self-fund themselves. Now, some people will just say, okay, I'm quite happy to pay this, but many people go for self-funding, not because they can necessarily afford it totally, but because they can make ends meet if they do, and they feel proud about wanting to be in receipt of public assistance. And it's those people in particular I'm thinking of here. And I note that there is some degree of discretion in here, but I know what discretion comes down to in modern local authorities. There's rules that say we don't look at it unless it's absolutely insisted on, and then we're as ungenerous as possible. Our business support grants for COVID being a classic example of that. So I'm a bit anxious that in introducing this, we may actually be creating something of a risk, but also we are kind of removing ourselves a little bit further from that compact between the taxpayer and the service provider whose services are paid for by the tax. And I just wonder whether ethically this is, I know everybody else is doing it, but it's an expedient rather than anything else. But ethically, whether really we feel that this is the right thing to do.
Okay, Keith, or
I take the point, Councillor Biscoe. I think I would stand corrected, but what we're not talking about here is charging for information and advice. We're talking about the charging for the actual arranging of services once that's been determined as the way through. So I completely take the point that we should expect, and we absolutely do expect to be having a conversation with people to help them through to navigate their way through into the process and to understand what their options might be. It actually serves us well to do that. This is the step on from that though, which is in terms of actually engaging workload and engaging with the provider to arrange those services. That is a step into provision of a service, and that's the point at which effectively that charge comes into play. So it's not an information and advice levy essentially.
And within the arranging of things is where the greatest risk applies, because people may not understand the complexities of the market or the nature of contracts, or indeed who's who. And of course, this world, as any other part of the world, is not devoid of rogues. And in that sense, I feel that we just need to think twice about this. The thing for me, Chairman, is to understand also what amount of money the council believes it will render as the result of making this charge.
I think Mr. Hoddenott wants to come in, Bert, and he might have an answer to that question.
So there's a few points to make. The first is that Keith's absolutely right. This isn't a charge for advice and identifying which providers are available in the market, and it specifically applies to those people who ask us to arrange for their care and support through a residential care provider, a nursing home, or a home care provider. So I take your point, Councillor Biscoe, that there can be some rogues, but we do have quality assurance processes. So the majority of our providers are, in fact, all our providers are legitimate and fair. The charge is expected to bring in around about £45,000 per annum at the current level of self-funders that ask us to provide this support, which is around about 150 people per annum. However, it is their right to ask the council under the Care Act for support for all self-funders, which could be a significant cost burden to the council. So the other point to make is that the majority of people who have to pay for all of their care costs currently arrange that directly themselves. And as you pointed out, there is some discretion within the policy that if we do have exceptions where we believe that somebody may ultimately end up in a period of self-neglect, they may not arrange their care and support, we have the discretion within the policy to waive the charge.
Okay, thank you. Councillor Kirkham, Jane, please.
Yeah, just a couple of small things. Just to say, Derek, thank you very much for the consultation. I've spoke to the partnership board and they think that really that the council have done as much as could be done by extending the consultation, consulting with the partnership boards and trying to reach as many people as they could. So that's good. This is just probably a naive question. Our new policy, we're going to charge for home care from the date that the service commences. I assume that's the same for everybody and that all the other councils do the same, but we don't backdate our financial assistance to the date when you start in a care home. Is that just completely separate and just the way that the central system works as opposed to how councils work? But yeah, just to say that the consultation appears to have been successful.
Thank you very much, Jane. That's good feedback. So in terms of answering your question, yes, you're right that all of the councils we've spoken to start to charge for home care services from the date services start. Your point about not backdating financial assistance to the date that services start is because people have to apply for financial assistance, and so it's from the date they make that application that we will backdate our financial support to.
Okay, thank you. Councillor Barbara Annenberg. Barbara, please.
Thank you, and thank you, Derek. Could I reiterate the thanks of the Carers Partnership Board about the extension to the consultation? It was very good of you to take on their concerns. My question really is, so if somebody's a self-funder, how much guidance would Cornwall Council give to a self-funder as to where they could or should look for assistance before they start actually charging. So I think what I'm saying is, would they only be charged if they came to Cornwall Council and said, I've got some care needs, can you sort it out? Or would they, and I presume then if they came to you and said, I've got some care needs, how would I go about getting them access to them, that they would be given that advice and guidance without charge, if that makes sense.
Again, thank you, Councillor Ellenbrook, for your comments about the consultation. Straight answer to your question is that we would only apply that charge if we have to enter into the contractual agreement with the provider that they wish to have for services. We will always provide people with information about the services available in their area, whether that be home care or a residential care home or a nursing home or day services, so that they can then make an informed choice and arrange those services themselves. That would not incur a charge.
Lovely, thank you very much.
Okay, thank you for that. Councillor Colin Martin. Colin.
Thank you for that. So I'm trying to think of the consequences of what this might cause. So on the charging for managing a contract, if someone decides that they don't want to pay for it, then they're kind of they might just be sort of left to face the wild west of the market on their own. So potentially that could mean that they end up getting themselves a bad deal or having difficulties. So you could argue that, well, that just means that what we're offering is good value for money, because for a mere £300, you can have the support of the council who know what they're doing. Is there any danger that that ends up coming back on the council, or is it just kind of, you know, if anything goes wrong, it's going to be the individual that suffers. So, you know, what we're offering is reasonable. Or is there any situation where they might turn around and say, no, actually what we want to do is go in for a different service. So rather than an independent, the people who are self-funding, can they come to the council to say, I'd like you to provide one of your packages of care, but I'll pay for it? Is that an option that people have? And if so, would we rather see people going in one direction or the other? The other unintended consequence, I think, is on the policy for not continuing to pay for someone's package of care while they are in respite care. Now, if that package of care is being provided by a big organisation and that member of staff can be redeployed in that week, or they use it as a holiday week or whatever, then maybe that's okay. But the next item we're going to discuss is the workforce and how we get more people into this sector. If we now find that what happens is, you know, you take this sort of fairly low-paid job working as a care provider, and then when someone goes into respite, basically you're just left penniless for a couple of weeks. You have to go to the food bank or whatever because your money stops coming in. I just wonder, are we in danger of creating some negative situations there? And then the last little query is, we've got this policy that says where the council funds care, we insist that it should be done to the ethical care charter, including the foundation living wage. Does that apply where we arrange care? So it's not going to be funded by us, but would we say that we as the council will be happy to negotiate a contract with someone where they're paying people below the foundation living wage? I'd be interested to hear that one. Thank you.
Okay, there was quite a lot there, Councillor Martin, and so you'll remind me if I miss any points. So the first thing, in terms of where people do self-fund and arrange their own care and support, in terms of how that they avoid being charged an excessive amount, one of the policy change, that's not policy change, one of the points of clarity within the policy is that we're going to publish expected charges, so people can have that as a reference guide to guide their own searching in the market. The second point is that the fee that we are proposing to charge is purely an arrangement fee, so there isn't a comeback on the council in terms of if we arrange for care and support and it's not appropriate, because all providers that are registered with CQC which is the only ones that we would make an arrangement for care and support. And Councillor Rochell has already put into the chat bar is that we will never recommend a specific provider. So it's down to what the individual chooses as their provider and ask us to manage the arrangements with that provider, to enter into the contract and subsequently manage that contract with them. So that is
just to cut in there. If someone says they want to employ a private individual personal assistant, does that get covered in what you're saying about sort of registered providers, or are we only talking about dealing with larger companies?
This is only people who are registered with CQC who provide care and support in Cornwall. If somebody wants to,
pardon my ignorance, do individuals doing personal assistance register with CQC in that way?
Individuals don't register with CQC. The way in which people would engage an individual would they could do that via the source of a direct payment, or they can do that directly themselves. That's not so. Arranging for a personal assistant and finding and helping them employ somebody, if it's not through a direct payment, is not something that we are talking about here.
Okay.
You've then asked around how do we make sure that we don't leave people penniless for a period of time when they're in respite, and that's the point that there's a number of points made at the back end of the paper you've got before you today, which address the points about mitigation from the comprehensive impact assessment. And included in that is that we would never introduce a charge unless we've undertaken a financial assessment to ensure that it is an affordable charge within the context of the charging regulations. So you've raised a number of points. Have I covered everything you raised?
Yeah, more or less. I think just the thing on that is it's not so much about leaving the individual penniless. It's just that they might have to say to their service provider, I'm not going to pay you for 2 weeks because I'm going into respite care. So does this policy take into account the effect that it's going to have on the actual care provider? Because if they're not a big company that can flex things around, potentially we could be putting some low paid workers into quite difficult situations.
Yeah. So where we are arranging a service for somebody who is entitled to financial support, if somebody has a break from that, we have an arrangement to pay part of the fees while somebody is not being supported for care services. But where it is a self-funder, that's a matter between. Sorry. So
I think someone just made an accidental noise in the background. They weren't trying to interrupt you.
So we do have arrangements for services which the council commission.
So we take care of our providers that way. We cover those sorts of gaps for our providers, and I lose track. Part of what we're talking about was about so self-funders. Yeah, so we've got one bit of this conversation is about self-funders and the fee we charge to them. That's over there. That's fine. This bit of the conversation about stopping our payments towards the cost of care, that's talking about care that we fund. And so you're saying there is a policy in place that at least pays part of the wage whilst someone's normal care provision is suspended.
So let me just sort of take a step back and clarify this. So in the event that somebody no longer receives their care and support, if we arrange it, then we have a position where we will pay an amount of money to hold that place for that individual.
Okay, and that applies to individuals on sort of direct payment, personal allowance, personal assistance.
So any services which we fund and make arrangements for will get covered by that arrangement. Yes.
Okay, thank you.
Okay, thank you. Hang on, somebody's just come into the box. Yes, we need to turn to a new system on the Teams meeting. Tracy, do you want to do that now and start the new meeting?
Yes, please. If members can just stay on this meeting and officers, and then any members of the public will need to join via the new live stream link. So if everybody could just turn off their cameras, please, and mute their microphones, and then just stay on this link for the moment. We'll advise you when it's ready to start again.
Thank you.
Thanks.